Nothing like listening to a little Rick James to start off the morning. So the moment I walked in today, everyone was asking me, we didn't see you at the party. Where were you at? We didn't see you at the party last night. And they have a good reason. But before I tell you about that, what I want to do is I want to create a party with you really fast. I want to show you my dance moves. But I need your help. So we got a competition. On this side, I need you to make as much noise as you can when I point over here. And then we're going to do the same thing over here. And at the end, we have a prize. So I think we have enough for everyone in the room, whoever wins. So we're going to start it off. With this side, go ahead and make some noise for me. All right, that was pretty good. All right, this side, make some noise for me. All right, 2 more times. This side, make some noise for me. This side, make some noise for me. You think this side won? Who you think? Are these folks over here the winners? I don't have any dance moves to share with you right now. But in society, that's how easy it is for us to be divided. The true winner is when we make noise together at one time. So let's all make some noise right now. And as we make noise, we have to know what we're making noise for. And as we go through life, we realize that life is built up of moments, and this happens to be one of them. So now we're having a moment for humanity as we work together to solve some of these issues. Now, last night, the reason why I was not here is because I was invited to facilitate a conversation with Yo-Yo Ma and Mr. David Brooks. And in this conversation, it was so rich, but the conversation is not what I want to share with you. I want to show you an experience that Mr. Yo-Yo Ma did. He was speaking about homelessness, and he was speaking about some of the issues in the community. And there was a gentleman who lives on the streets, and he was angry. And he began to yell and say, I'm tired of people talking. I'm tired of hearing all these people talk and don't have no clue what it's like to be homeless. And he started yelling over Mr. Yo-Yo Ma. And what Yo-Yo Ma did was he got off the stage and handed this man a microphone, gave him a platform, and gave him a voice to speak, to be heard. And oftentimes, that's what people want, is to be heard, to share their story. And right now, we all don't have the platform to speak. So sometimes it's good to hear someone speak on our behalf. But sometimes speaking takes a lot of courage, because sometimes people don't want to hear what you have to say. So right now, what I want you to do, like before, I want you to find a nice, seated, comfortable position. You can rest your hands in your lap or wherever you find to be comfortable. And I want you to begin to slow down your breath, soften your shoulders, relax your face. See, doing this work can be really heavy. So that's why it's important to allow yourself to calm down. Allow yourself to relax. Now we're going to inhale. Now as you inhale, you're going to slowly turn your head to your right. And slowly exhale to head back to center. Inhale to your right. Exhale and back to center. Last time, inhale to the right. And exhale back to center. Now we're going to inhale to our left. And as we exhale, we're coming back to our center. Inhale to your left. Exhale back to center. Last one. Inhaling. Exhale. Now, no longer manipulate the breath. Allow it to flow freely. Soften your shoulders a little more and reach up with the crown of your head. And begin to think about the platforms in your life. What platforms in your life are you creating for other people to have a voice? And how well are you listening to what other people have to say? I want you to take a moment to breathe into that. Now begin to slowly open the eyes. And now we're all going to slowly stand up. And for me, I love human connection. So what we're going to do is make your way out of your aisles, and we're going to come up towards the stage. Everyone's going to come up towards the stage. Everyone. Briefly. So you can come on the stage. There's enough room on the stage, off the stage. All of us as a community, as a collective, working together. Coming close. A little closer. Y'all can come on the stage with me. Everybody coming close. Come on the stage. Yeah, come on up here. Give it up for the little man right here. Hey. Now what I want you to do is place your hand on the shoulder to the person next to you. Oh, there's a spot. There's definitely a spot for you here. Now what we're going to do, we're going to bring our right leg up. Hey, no shaking. Exhale and release down. Bring your left leg up. Hey, and release down. All right, this time you're going to release your hands without falling over. We're going to slowly bring our right leg up. Close your eyes. Oh, don't do that. Exhale, release. Left leg up. Close your eyes if you can. Exhale, release. So she just said something really important. What she said is, I'm going to fall over.
No, I actually said I'm going to fall on you.
Oh. Hey, now to catch you. And that's what community looks like. As you see how difficult it was for us to do it on our own, but when we were supported, it was a lot easier. You had more support, and you can fall on your neighbor, and hopefully they're there to pick you up or catch you. And that's what this work is about, so never forget that. So what I want to do right now is create a voice. I want to create a platform, and I want someone here in the audience to tell me something that you would tell someone as you can inspire them. What is something that you can say that you feel someone needs to hear? Anyone right here with the microphone, what do you feel that people need to hear? If someone had to give advice to a young child who's dealing with trauma or struggles in life, what is it that you would say?
I would say, you're not alone. Find people that can help you not feel alone. And to all of us, find people who may look like they're alone and make them feel like they're not alone.
Thank you for that. Thank you. So my time is running out, but I want to share a quick story. So on my way back down to Denver last night, I ran into people and I was receiving text messages, and people were saying, hey, I've been seeing you live streamed at the Health Symposium. People from all the way in Reno, Nevada, in downtown Denver. And one thing that happened was a lady by the name of Lisa said, I was watching you in my office, and it's been a really rough week. And Monday and Tuesday was rough, but I seen the opening. And I started having a conversation after I seen that opening, and my staff started having a conversation about how we can start treating each other a little better, and it made my day better. So people are watching today, and you all are making a difference, and I want you to know that, because sometimes we're divided, and sometimes we don't realize how easily we are divided, and we can be celebrating and making noise for one issue, not realizing that we're losing our humanity in the process of doing that. Because as a collective, we rise together. Everybody okay with that? Y'all want to rise together? Y'all want to keep working together? Keep dreaming together? Keep believing in each other? And one other thing that happened yesterday is someone did not like what I had to say when I talked about Joe Montana. They says, you know, there's a lot of people to blame for the issues. And I feel like if we don't blame those people, then we're doing a disservice to the work that needs to be done. And I say, if we spend a lot of time blaming everyone, what are we actually doing about what needs to be done? And he says, oh, okay. I get it, because sometimes that can take away our energy, and that can tax our system, and we can become depressed, and we're doing this work, and we're not taking care of ourselves in the process. So if we are living this, if we are breathing this, then that's where the change happens. So everyone in this room today, you are making a difference. And me, I thank you, and I thank the leadership of this organization to make these kind of moments possible, because this is a moment that I believe can create a difference, can create change, and it doesn't take a whole lot. It just takes us to be willing. Thank you. You can find your way back to your seats now.
You've been amazing.
Thank you so much. I appreciate that.
You need help.
I was going to say, did you take mine? Can we thank Tyrone Beverly and his team again for all they've done this week? They have been active. Not only has, Tyrone been doing our opening, but they've been doing the listening, the relaxation station. They've been doing the fragrance. They've been doing the yoga. They've been doing the hikes. So they have been all over the place, and I just want to thank them again for that. So good Friday morning, the few and hardy. So I hope you all have, if you haven't, please put your name in the bowl. We will be drawing at the very end for the two $10,000 donations. You do have to still be here at 11:45 to receive that. Oh, I realize I don't have my clicker. Here we go. So I wanted to share a picture of my son. So many of you were so kind yesterday to say something nice and kind about my story about William. That first little picture up on the is that the left or the right? Your left is about the age he was when we first started going to the worry doctor. And then the other three are very recent. And you see him in escorting me. I go to a lot of galas and a lot of dinners, and my husband is not having it. He says, you get 3 a year. You can pick the 3, but you only get 3. My son, however, loves going to these things with me, so he's my escort for a lot of things. So last night when I told him that I'd shared some of his story, Mom, you know our agreement is you can only talk about me if it's going to help somebody. Did it help anybody? I said, well, I think it made an impact on some people. He said, name one. I said, okay, I can tell you about a conversation I had with someone, and he was impacted by the fact that he too was adopted. He too had a birth mother that was a drug addict. He too understood the kind of anxiety, concern about, whether that addictive trait is, part of your DNA. And it was just really special to him to kind of hear somebody else talk about it. And he said, okay then. So I wanted to share that. I also wanted to share some feedback that we've been hearing over the last few days, last couple of days. One, quite a few of you have mentioned to either me or one of our staff that you've noticed some negative or critical commentary on social media about the symposium and about the foundation or about some of our speakers or me. Yes, we know. We're aware. We were in contact with that organization over the last couple of weeks. We were expecting it. We happen to not agree with their interpretation of our behavioral health agenda. They have every right to voice their opinion. We just happen to agree with a vast majority of their opinion. That being said, I'm going to just Plan B. But that being said, that we disagree with their interpretation, that doesn't mean that we dismiss their feedback completely out of hand, because there are elements of what they are sharing and saying that we need to pay attention to, that we need to be sensitive to, and that we need to be aware of. So it's not, I don't want to say that their commentaries and not in vain, but there are elements that we certainly support and believe and think that the foundation has to pay attention to. So I wanted to talk about that. Now, after yesterday, last night, I wasn't sure if I was full or if I was empty. Yesterday was an intense day, and we had a lot of conversation and a lot of positive comments from you, but there was a lot of conversation around the panel of young women. One of the comments that we heard was that it was exploitive to have them up here, and to that I actually want to respectfully disagree. All of those young women we learned about because we saw them speaking somewhere else. They, with the exception of Mia, the other three are quite accomplished and quite experienced at speaking in front of groups, and it's their part of it. They consider it both part of their recovery and part of their mission and purpose. So Macy Ray, thank you, Jeremy. Macy Ray and her family, of course, came as a family unit. Macy Ray has her own nonprofit. Even when I asked one of the questions, she said, well, usually when I'm asked that question, I have like 20 things I tell people, but I'm only going to give you 2. So she's quite accomplished. Cassandra wasn't able to stay afterwards because she had another speaking engagement to go to last night. And Amara was the least one fazed about the crowd size. She said, I've spoken to crowds much larger than this. And Mia got a little taste of it, and I think Mia now is kind of going to make this a habit. She's becoming now want to be an advocate. So those young women wanted to tell their story. Most have told their story before. It's part of their purpose and their recovery, and so I just respectfully disagree that was exploitive of them. There was also quite a bit of concern around Amara and whether or not she was re-traumatized on stage yesterday. And as you heard, Amara can speak quite well for herself. So I asked her, I went to her and her grandmother and said, here's what people are worried about. People are worried that you were re-traumatized. You won't be here tomorrow. What is it you would want me to say about that? And Amara first laughed, and I said, no, I'm serious. I'm going to address this tomorrow. What do you want me to say? She said, well, I did, she said, it did probably it caught me off guard that it kind of hit me that hard. She said, but I just take it as a testament to how far I've come. And it's just still part of my journey, and this is all part of my recovery. And she said, and even after I kind of broke down, it actually made me calmer. And her grandmother said, first of all, thank you for being concerned about her. And her grandmother said, you know, to many of the folks in the audience, it was a traumatic story to hear. She said, but that's our life. And so to us, it was just Thursday. And tomorrow, it'll just be Friday. And she said, Amara hasn't cried in years. And so the fact that she did, her grandmother took it as a blessing and a breakthrough. So that's from them, their reaction to some of your concerns and worries. And then there was also concern about part of what Mara talked about, suspected abuse of her sister. And so what was our obligation as a foundation? What was your obligation with that knowledge? And when I mentioned that to Mara's grandmother, she said, you know, we have no idea where Amara's mother and sister are. We haven't heard from or talked to them in years. We don't know where they are. Amara assumes that because she was abused, she assumes that her sister is, and she would love to save her from that if that's happening, but we have no idea where they are. And even Mara, as you recall, Mara said she doesn't really remember how old her sister is because she hasn't seen her in years. So we did follow up with that. We don't know that there's anything we or you can or should do about that, given that even they don't know where they are. And then I don't know how many of you came up and said, you know, we are going to pay for Amara and Mia to go to college, aren't we? And I said, well, you know, the foundation can't do that. We can't give a gift to an individual like that, and we can't, most colleges don't accept, you can't set up a scholarship for a specific person. However, if anybody wants to set up a GoFundMe page or crowdsource it, I'm sure we can probably, there are plenty of people in this room that would contribute. So that was kind of that's just kind of a recap of the feedback from the last couple of days, particularly yesterday. And I heard lots of people talk about that it was just a heavy day. It was, some of the stories hit close to home, or some of them were just, it was just the sheer weight of them all, one after another. And if you didn't come to the screening last night of the movie Escape, written, directed, produced, and acted in by the young people of the Ute Mountain Tribe, you missed a treat. And so now mark my words. So we're going to have Amara who's going to write the Netflix series, and we've got these young people at the Ute Mountain Tribe who are going to have the production company. It is going to happen. And it was outstanding. So I do think if you go to the website of the tribe, that movie and another one that was produced and made by the youth are on there available. So it's well worth, and they're 35-minute movies. So not a lot of your time, but well worth your time. And then lastly, I always have to give my dance awards for the dance party. So the junior award, I don't know if he's in the room, the junior dance award goes to DJ McClanahan. I don't think DJ's here, But to DJ, we will give a $250 gift certificate to help with those back-to-school expenses. And then in the adult division, we've got Dee Dee, and I don't know what Dee Dee's last name is. Where's Dee Dee? Is Dee Dee here? What's Dee Dee's last name? McPherson? McPherson. So we will make a $1,000 donation to Dee Dee's organization. And then for the male, there was Aaron Miltenberger. Who had some serious moves. And so we will make a $1,000 donation to the Boys and Girls Club. And then on the staff side, Todd Van Minter and Alexis Waitman. Alexis was unencumbered by her family and kids last night, and so we saw that. So they get an extra day off. Okay, now on to our program. We wanted to just also give you some resources. Certainly this is not an exhaustive list by any means, but people wanted some resources to who they could call or who they could share with their friends and family to call. And then we will put, I think, Taryn, we're going to put some other resources up on our website. So the listening lab this morning, now we've got you here, and we're going to let you, you are going to be the program. So we're going to have 3 rounds. Going to have a question each round. And so we've got 15 seats up here, actually 14. The 15th one's for me. Going to have 14 of you volunteer to come up and spend 20 to 25 minutes talking about 3 questions. Here are the 3 questions, but we'll only do one at a time. So the 3 questions are, the first one is, what's the path forward to create an equitable preventive, treatment, and recovery system in Colorado? So think about whether you want to comment on that question. We're not re-identifying problems. We're talking about solutions and the way forward. Second question is, what and where are the next generation of cutting-edge practices and policies that we should be looking at and working at, whether they're here in Colorado already, whether they're somewhere else, what's out there that we should be paying attention to? And the third question is, so what's the role for the foundation? So the 14 people who want to come and talk about this first question, what's the path forward, come on up. We have a ramp if someone has a physical disability and can't climb the stairs. So those 14 people who want to talk about this question, come on down. Come on. If only these folks want to talk, then you'll get more time to talk. If there's seats still open and you want to, and they say something that triggers something for you, you can come on up and join us. So we've got microphones, probably for this crowd, about one for everybody almost. Grab one over there. Get that one. All right, so very quickly, just tell us your name and the organization you represent, and then whoever wants to start can start.
Hi, my name is Kristen Bates. I'm the Director of Strategy, Policy, and Communications for the State Office of Behavioral Health under the Department of Human Services. Hi, my name is Veronica. I am a student in the Colorado School of Public Health. I'm going for my MPH, and I also work as a coordinator for Developmental Pathways, which is a nonprofit organization that provides services to individuals with developmental delays.
I'm J.K. Costello, and I'm a physician consultant with the Stedman Group.
I'm Cindy Rowert. I'm a physical therapist at Platte Valley Medical Center, and I work with people with persistent pain.
I'm Kimberly Bahanic, Regional Director for the Center for Mental Health in Gunnison and Hinsdale counties.
I'm Ingrid Johnson. I'm the Senior Director of Operations and Policy at the Colorado Center for Nursing Excellence, and I'm a nurse.
And we'll just start sharing the mics.
I'm kind of falling out of the picture, but my name is Suze Bolay, and I come from the organization that is Americas for the Conservation and the Arts.
Hi, I'm Dr. Carl Nassar. I'm the president of Heart-Centered Counseling, an organization that's committed to expanding access to behavioral health care in Colorado.
Christina Guerra, I'm the executive director of West Mountain Regional Health Alliance.
And Sharon Raggio, I am CEO of Mind Springs Health and West Springs Psychiatric Hospital.
Okay, so we'll share some of these mics over here. Who wants to start with the first idea of the path forward?
I'll start. One of the things I think is really important with the path forward, and certainly this conference has started to address, is the issue of stigma and breaking down stigma. I would suggest that peer workforce has a significant opportunity to help address stigma even more and to really create some outreach. I think one of the things that we've seen from our speakers, as well as I know I experience in our organization, is that people with mental health and substance use disorder challenges often are not the first ones knocking on the door saying, I need help. And it really takes some engagement. And I'm a big believer in focusing on engagement and engaging people into treatment. Treatment works, but a lot of times people, and we heard this from some of our speakers, people will start treatment and then drop out. And we really have to be about meeting people where they are at and engaging them. And sometimes that means not waiting for them to call and come into our office. It means going out to where people are. And I'm a firm believer that a peer workforce is one of the avenues to do that. At Mind Springs, I'm proud that about 10% of our workforce are peers, and peers are people with lived experience, people who are in recovery from a mental health challenge or a substance use disorder challenge. And they do things that a professional cannot do, and they are able to reach people in ways that a professional wouldn't even begin to touch. And that's not to say the professional stuff isn't needed also, but again, we're not going to be successful unless we're about engagement. So that would be one of my thoughts with respect to a path forward.
And just so people know, the staff are taking notes. Other comments?
I think it's really important to have community-based solutions. I went to a presentation by Vermont, who has a really good drug treatment system, and it really clicked. I knew everything that they did. I'd read it all online. But one of the guys said, things got better when our community started to take ownership of the problem. And it really clicked for me that that's sending people to Florida for rehab is not going to be the solution to substance use or mental health problems. And so I think creating things in Grand Junction and in Durango and Steamboat and Frisco, that really takes ownership in the community and doesn't send people out. So that people can have peers and have their community and their family around and have jobs and be in their housing is really, really important. So I think that's particularly for substance use, part of the way forward.
We often run up against access because we're a frontier community, and sometimes just getting to the clinic beyond the stigma of coming to the clinic are huge barriers for us. So in addition to peers, I also believe that from the insurance company's perspective, there needs to be reimbursement for mental health and substance use work in the community, and that it's not disallowed automatically, that if there is a medical necessity reason that we need to be serving in the community or a different location than our clinic, that we should be allowed to do that and reimbursed to do that.
I think a lot of parents had questions yesterday about if I don't see the signs, if there aren't warning signs, if my kid won't talk to me, how am I going to know that they need help? And I think that SBIRT, Screening, Brief Intervention, and Referral to Treatment, which is an evidence-based program in schools, is a really valuable thing. I know our state has worked really hard to get this done, but when we look at screening early and often, that's where you're going to find individuals who maybe don't feel comfortable talking to their parents. There was a lot of youth suicide work that was done last year, trying to move forward, how do we do more youth suicide prevention? And the kids came and testified in front of the legislature, and they said, even kids who have good relationships with their parents may not be able to talk to them, but especially for kids who don't have a strong relationship with their parents or their parents are part of the problem, they need to be able to be identified and connected to treatment. So I think that using evidence-based programs to screen youth in schools is a fairly essential thing, and then also making sure that we have peer support and access so the referral goes somewhere would be the other very essential piece of that.
I always look at healthcare from a workforce lens because I work for the Healthcare Workforce Center. And when I go out into rural and underserved areas in Colorado, what I'm very, very sure of is that if we don't build that workforce from within that community where they are, it's going to be really hard to do. And communities really like to invest in themselves and their own people. And when you look at behavioral health, it's a sensitive issue, and it's really hard. So I think we have to look at from a workforce standpoint, at trying to build that behavioral health workforce from the communities in which they already live. So we're not trying to relocate folks into areas on loan repayment or whatever, and it's not just physicians and it's not just nurses. It is a much broader healthcare workforce that we have to try to start building from within the communities in which they already live.
And to build on that, I also agree. I think I come from a physical background, and so I understand I can work better, more interprofessionally with behavioral health practitioners, and I feel that would greatly benefit my patients. And also I can do a better job at screening and knowing how to refer, and the mental health first aid could be a great pathway to that.
I would just add, recently I had a friend who I did not realize was suffering from a substance abuse issue, and for various reasons he shared with me what he's going through. And I told him, I said, you know, I know where to refer you and where to get you involved, and I think what people have said is very apt, because he said, I don't think I'm ready. And I said, well, I'm going to give you the resources anyway, and I'm going to keep encouraging you until you are. But I think part of this process is just normalizing that people have mental health issues. They have substance abuse disorder issues, and it's not a failing on their own part. It is what it is. And so I would advocate that it would be awesome if when you went to the doctor for your wellness visit, you also had a short mental health wellness visit and had a chance to maybe talk about the stressors and what's going on. I just feel like it's not normalized, and it's like, oh, there's still that understanding of like, oh, you went to a counselor, you talked to someone, and so we have to erase that and create a safe space so people can get the support they need.
So I just wanted to add the importance of family, and I think we saw that yesterday with Nick and his father. And, you know, I work for the state, but I'm here representing myself because I have family members that have been hugely impacted by this. And as a family, I have not felt empowered to improve their lives, for them to improve their lives. And so that's what I would like to see, is I would like to see families empowered. And the situations that I'm involved in, they're adult family members. which makes it even more challenging. But things can go off the tracks really fast, and it changes someone's life forever when they do. And so I would like to see families as a part of those discussions in the wellness, the treatment, the identification, and the planning for our family members.
Yeah, I just want to add a couple pieces. First, I just want to say that I personally love behavioral health. I love mental health. I have when I met my wife about 25 years ago, backpacking through Europe, we began traveling together, and as we were talking, she said that she had a therapist, and I said to her, "What's wrong with you?" And that didn't land very well. We got through that, luckily. But that was an introduction to me to the world of therapy, and I really view this as a very rich field. I look at mental health in terms of what it can do, and if I think about it from a very pragmatic standpoint, from the standpoint of cost savings, I see mental health as having the capacity to be a tremendous cost savings across fields. Certainly there's tremendous data showing the cost savings in physical health, but there's tremendous cost savings in a number of other systems. My hope is that over time, as behavioral health moves more into the forefront, and people aren't saying what's wrong with you when they say they've gone to therapy, that what happens is that there's a recognition of how much more funding behavioral health needs. We have a tremendous access to care issue, and as we work to resolve that access to care issue, as more people step forward to create access to care and more people get support, that lends itself to needing more funding for all that increased access. So my hope going forward is that as we start to recognize how important and valuable behavioral health is, that we are able to increase access to it and increase funding to support that access.
I'd like to piggyback on that. My name is Denise Kidd, and I'm a licensed professional counselor, a licensed addictions counselor, substance abuse professional, and an AccuDetox specialist. I'm the Addiction Recovery Services Coordinator for the Public Community Health Center. So that program or that service is designed to provide MAT services to pregnant women addicted to heroin. We also treat their partners if they are also using. And one of the things that I want to say, and is just profound to me, is as a licensed professional counselor, and increasing access to services for our senior age population, is I cannot bill for that service because I have to work under the supervision of a licensed physician. So it's a huge soapbox of mine. There are many, many wonderful, excellent counselors out there who are licensed to provide great benefit in accessing services to our senior age population. So I would want to encourage everybody here to write to your legislators to ensure that legislation is passed, again, increasing access to services for many of our senior age population. Very important issue.
I would just echo that and say that there are multiple policy changes. The one you just spoke of is absolutely a top-of-mind one, but there are multiple policy changes, and I know that's really our next question, so I might just stick around, Karen. But really, the substance use disorder funding is separate from mental health funding, is separate from physical health care funding, and we're not treating the whole person when we have separate funding silos with separate reporting requirements and separate access qualifications, and that's a huge challenge.
I would like to piggyback on something that was mentioned earlier. I don't come from a mental health or behavioral health background. However, I believe that unless we really see a patient not as in isolation, but as part of their family structure or lack thereof, we will have keys to the answers in many ways, because a lot of this, a lot of behavioral health is connected to the disconnection of that we feel nowadays. That's why when we're connected here, whether it's on the stage or with putting our hands on the shoulders or in spirit, because we believe in this and we all kind of rally around it, like, you know, our cause at the moment. We need this in order to actually rejuvenate ourselves, create energy, and so on. Our organization works really, it's really important to also do the peer workforce, have community base and work with the community, increase the access, create a safe space for everybody, and actually strengthening the positive assets. And the most important, that is the first step to policy changing. Because once you have everybody involved and engaged and giving them agency to not only make decisions, but becoming agents of change within their own community on a smaller level, you don't need to have a degree to actually heal somebody and at the same time heal yourself. We work a lot with the arts, but we work in a very spiritual way with each other. And unless you commit to do the work yourself, that you do with whoever you want to treat, I think it's not going to work. And of course, we have to look at the reality of the healthcare system, which is totally screwed. But, you know, we just have to be hopeful as long as we get more and more people involved to make the shift and create that agency.
Hi, I'm Patty Boyd from Tri-County Health Department, and I would like to speak to two things, and really from a population health standpoint, and stigma has come up a couple of times. We know from research that's been done that we're all aware of stigma, and we all know it's not good for our work, but yet in our actions and our thoughts and the way we treat each other, we are stigmatizing. So I think for prevention to really start to occur, that we, as we've heard throughout this conference, we've had multiple times to talk about stigma, that we come to some kind of agreement. And someone said once, you just have to throw a noodle on the wall and see if it's going to work or stick, and move forward with some good language around stigma. The other area I think we have opportunity in Colorado particularly is around our conversations with risk and protective factors. We have multiple grant programs that use different language, and we go out into our communities and we promote risk and protective factors with a different language in each of those communities. If we could come up with some common language that talks about trauma-informed care and ACEs and use it consistently, then we would, I'm a chemist by training, and that saturated solution experiment you remember from grade school when you had to keep putting the drop of food coloring in the glass of water, well, I think we could turn the water green. But we all kind of own our own language and don't really kind of want to come together on that. We all have mental health. We all have good mental health days. We all have poor mental health days. So getting our feelings and our head attached to our physical body, I think, would be helpful.
I'll
give you last word, Veronica. Go ahead.
I just wanted to build on what was said earlier about engagement and also including the community into policy changes. I think that building resilience in the community is important because there's not enough mental health providers meet the needs of everybody, and there's also not enough representation. So I feel that training community members to address the mental health needs of their community is important. There are a lot of organizations doing that via promotores, and I think that that's important to meet the need. And also, I feel like organizations should build more collaborations. I feel that each organization has their own rules, their own policies to meet, but they're not really collaborating, and some organization might have a resource that other organizations do not, and I think that more sharing of resources could help meet the needs of community members.
Go ahead, I'll give you.
Yeah, I wanted just to say one last thing about integrated care. For example, the public community health care, we're talking about, I hear a lot about stigma with the mental health side of things, substance use disorders issues. If any one of you were to come to our clinic, you would not know if you were being seen for a medical visit, for a mental health visit, because of that integrated piece, and that's the beauty of the integration to help get away from that stigma.
Thank you all for your comments, and as they leave and the next group walks up, let's give them a round of applause. Thank you. I see you first. Yes, if there's room. Yeah, let's just see how many people come up. All right, here's the next question. What's the next generation? Aha. You can come on back. Come on. What's out there that we should be paying attention to? And again, if you will, just quickly go around and tell your name and your organization, and then we'll get the conversation started.
My name is Pam Giner. I'm an organizer for Girl Trek, nationwide walking health organization, 150,000 women strong. We're walking to prevent preventable heart diseases.
I'm Erin Miller with the Colorado Children's Campaign.
Ida Rhodes with Catholic Charities in Pueblo.
Hi, I'm Susan Motika with Boulder County Public Health.
I'm Anne Marie Peterson with Alamosa County Public Health.
Bill Fulton with the Civic Canopy.
Sharon Raggio with Mine Springs and West Springs, and I threatened to come back, and I have, so thank you.
Bethany Prey with the Colorado Center on Lawn Policy.
Beth Rolstad with Homeward Pikes Peak and the chairperson of the Pikes Peak Continuum of Care.
And
Linda Osterlin, Academic Dean of Rickard Hartman College for Health Professions at Regis University.
Okay, who wants to start?
I'll start. One of my biggest concerns is sober living homes in the community and their lack of licensure and policies and standards to protect those who are living in sober living. It's kind of a free-based economy right now, and I think that there's some harm that's happening in those sober living homes without any regulations.
So what's the fix?
There could be a licensure that anyone who's operating a sober living home could need to be licensed by the state, and I think that would provide protections for those who are living inside and alleviate concerns of family members who are helping to pay for individuals in sober living when they're not actually moving forward in their recovery.
Thank you. Got it.
So I'll go next. I'm a big advocate of two principles that I think will really move things forward. One is I think we need to have a global budget where it is one healthcare budget that encompasses substance use disorder, mental health, physical health, prevention, which often isn't talked about enough and certainly not funded. But I am very much in favor of a global budget as opposed to a fragmented budget. And then secondly, I really believe that we have to get to a level of community integration. We're doing a lot of practice integration, as has been discussed. I think we have to get to a level, and it was talked about a little bit in our last thing, of community integration where community organizations are deeply collaborating and creating a community-based continuum of care to include all of the social determinants of health, and that's all of the prevention and all of those things. And then it is funded at the community level, again, in a global budget way. Let communities find their own solutions, because that's where it happens, is at the community level. Give communities the funding to do that, but hold the accountability that communities create, really at the community level, a system integration.
So I just want to piggyback off that in terms of preparing healthcare those who provide services and looking at interprofessional education experiences and core competencies for nurses, for counselors, for pharmacists, all having that experience at the university level where they are practicing in collaboration and learning from each other. And then those are the ones in the future going out into those community agencies prepared to have those collaborations and practice together to break down the silos so that we can treat people as a whole person.
Yeah, so I'm just kind of thinking as you mentioned that, Sharon, even before we get to some of the policy solutions, some of the discussions that I found most inspiring in some of the afternoon sessions were, it's unlikely we'll ever have enough resources and enough professionals to solve these challenges. They're so far upstream. And a couple of the discussions have pointed to, it made me think of that analogy of the canary in the coal mine of, the miners would send canaries in, and if the canaries died, that was toxic air. Sometimes I think our policy solutions are trying to equip canaries with gas masks or make them more resilient to toxic environments. Like we're trying to increase our ability to sustain lives that are fundamentally misoriented. And what is it that's producing the kinds of conditions that most of us find ourselves in? And one woman in one of the sessions, I thought she said there's a fundamental illusion that life in the United States is about individual success and achievement. And that premise alone explains so much, the stigma of why we have a hard time talking about these. I think in the conversations with communities before we figure out the policy solutions and the kind of practical professional, to be able to stop and say, what is it that's driving us into the patterns that we're in? And is it a myth that we want to perpetuate, that life is defined by individual achievement and the success we have? And it seems like that myth, in some ways, is a necessary one to keep in place the inequitable structures that we have. Because if I'm not entitled to what I have because of my hard work, that's a scary thought. Or if I can't blame somebody for their condition because they didn't work, that seems like that edifice is holding up a lot. And so if we were to challenge that and say, if someone like me who's in good fortune didn't necessarily always deserve that, someone who is experiencing difficulties didn't create those, we might start a very different conversation about how worthy each of us is in supporting that and kind of changing the pace of the lives that we tend to be living. So in addition to all of those policy solutions, I think some element of that fundamental question of what are we doing? Like, what is this game we're in the middle of, and is it the one we want to be playing?
In Pueblo, we started a little program called SCAN, Support, Connect, and Nurture. And what it is an intersection between medical and behavioral health. And what we have is a social worker embedded in a residency clinic. And what we are doing is we are screening folks with ACEs, adverse childhood experiences, and also a resiliency tool, and seeing where they are. And these are adults, but these are also parents of children, so that we can put in support systems to help lessen the next generation of ACEs. And it's taking an approach of what, not why are you doing what you're doing, but what has happened to you. And we know that so much of this is linked, not always, but so much of it is linked to these experiences in childhood, and nobody has had this conversation with people. And when we first started this experience, what happened was some of the physicians, some people were like, oh my gosh, how do we bring up, are we gonna re-traumatize people? You know what? The opposite happened. People wanted to talk about this. They were glad they were asked. And they were glad somebody listened to them and understood and said, okay, let's see, what do you need? Where do we go from here? And I think having that conversation is really, really important.
I think this is a great conversation and definitely a lot to think about. I think you're definitely onto something with those early childhood experiences and ACEs, and I think thinking even, how do we start sort of preventing some of those? And I think there are definitely some policy gaps in Colorado, but I think there's also just like questions here that folks don't exactly know how to answer. I think one space, and Dr. Brooks actually talked about this on the first day a little bit, but she talked about the notion that a pregnant woman with substance use disorders is a hot potato that nobody wants to touch, and yet they're often in a great place of behavior change. Pregnancy is a time when people stop smoking, stop drinking, make all sorts of life changes. And so thinking about how do we provide services for those women, and I think that there's a lot of barriers to that. I think childcare, like I've heard stories of women being in group and bouncing their baby on their lap, and it's hard to pay attention to so many things at once. I think, and then thinking about how do we better integrate, and folks have talked about this a lot too, but integrate prenatal care and substance use services, both so that women who are in MAT or something can get their prenatal care at the clinic where they can get MAT or near that clinic, and so that they, going the other way too, so that OB practices are more comfortable treating women who have substance use disorders and behavioral health issues in general. Maybe they're on antidepressants or other things. I think kind of then the next step is working on that dyad between moms and babies, and I think the conference has had a lot of conversation about sort of family units and parents and their kids, right? I mean, that's been brought up a lot, but those folks all exist in other systems too. So how do we create services that are doing good screening for postpartum depression at a child's well check, for example, which we now pay for through our Medicaid program in Colorado? How do we make sure that if a child screens for issues that the mom's able to get services also? So thinking about how do we connect early intervention systems, good primary care systems that families interact in those very early years, and create systems that support both parents and kids. And then lastly, getting to some of the social determinants of health that we know are important, and that's been brought up a lot. And I think Bill raised really good points about the systems that we work in, and do we need to think about reconstructing entirely new ones? I think that in the meantime, we know that, for example, food insecurity is a real driver for depression, and that it is a contributing factor for adolescent depression especially. And so how do we reduce food insecurity in Colorado? How do we make sure that kids are getting the food they need at school, that we have families, we have very low rates of enrollment among eligible people into WIC and SNAP in Colorado, and so how do we think about closing those gaps and getting folks enrolled in the services that they're eligible for as sort of a first step?
I'm going to tap back into the ACEs. I've been with a group of people in the San Luis Valley, and we spent a year of learning and how adverse childhood experiences not only affect the long-term physical health, but also change the structure of the brain. And we're looking at implementing screening and starting interventions in Head Start with these kids, because we have a kindergarten teacher in Alamosa who has stories about these kids coming into kindergarten with terrible behavior problems, and when they go back and look at the paperwork and their screening tools, these kids have these horrible ACEs. And we have to start somehow getting programs into place so that these kids and families can start having some resiliency will help prevent substance abuse later in life and long-term health problems. So I think we need to start addressing these adverse childhood experiences early in life.
As an outsider again, I think that it's really hard to work just through institutions of health centers and schools and things like that, because a lot of times that is feared by people that are not part of the general society. And if you are on a lower income, or if you are not included and integrated and sit at the table of the decision making in general, that's how you feel. And I think many of the people here may have never experienced that. We need to keep that in mind. And I wanted to come really to the point of what and where are the next generation of cutting-edge practices, and because our organization, Americas for Conservation and the Arts, has youth and family programming that connects public health with environmental health. Basically, we work with community health workers that then are trained with their family in environmental education that then really strengthens the base of their health knowledge and connects them deeper to the earth, and at the same time they become stewards of the land because we're connecting them to public lands. They have a place all of a sudden, even though they don't feel that they belong here, because just it happens that life threw them here and they are working 3 jobs and so on. But we work with families, intergenerational. The positive assets that are already there are built upon. And I think those are all things that we need to look at, because especially struggling people and families already have a lot of resiliency and positive things that we are not looked upon, and they're pushed aside and, oh no, we have the solution for you, here's a pill. No. We need to have that conversation in a Socratic process, in the community circle of how do you deal with that? And listen. We need to listen more, because just bringing book knowledge is not going to solve the problem. We need to be there with our hearts and create that deeper connection that will not just disappear easily. And so I always look at it, the future is to not only restore nature, which is necessary for us to survive, especially here in Colorado, restoring nature and restoring ourselves.
Yes. This is a first time for me here at a symposium like this. I'm so thankful for the Colorado Health Foundation. The fellowship has really enhanced my life. It has enhanced my programming, my dedication, my commitment to my community. I'm so glad all these policymakers and people with, organizations and businesses, it's your job to find policy that affects and can be effective within a community. Let me tell you about the community that I live in and my association with my organization, Girl Trek. Girl Trek is a nonprofit health organization for women, Black women specifically, because 137 Black women die every single day due to preventable diseases. We're talking about high blood pressure, diabetes, stress, depression, strokes, anxiety. These are mental health issues that, develop. What we do is we take it upon ourselves to free ourselves. Women, men, children, we all need to get outside of our environment. Like you said, we're so busy you know, with the congestion and the responsibilities of, am I being successful? Am I, you know, making it in life? Well, we're forgetting to live life. We're forgetting to connect with one another. We're forgetting to get outside and to find that time to heal, to listen to our hearts, to reconnect with our dreams, to find ourselves. We're losing ourselves in life without living life. I've been walking for 2 years. I have walked every block in Colorado. I can tell you the deficits in your community. I can tell you all the great things you have and the amenities you have in your communities. Walking gets you involved in community. It connects to people. I've been walking with seniors, a group of seniors, and nobody's talked about our seniors this week. 88 years and up for 2 years. Every Wednesday, these seniors come outside their doors excited to, number one, be outside with someone who cares about them. Number two, to improve their health, to reconnect with community. We take them to picnics, to parties, to activities that's going on in the community. Had them out until 11:30 at night on the 4th of July, really? I mean, they were out partying under the stars. They're coming back to life. They have abandoned their canes. They get to the park every Wednesday and they leave their walkers at the gate where we come in, and they walk in faith to better their health, mental and physical health. I'm saying that until we get this fixed out, something is working, and that is connecting to the people in your community and getting active outside. Women, get out your doors, connect with the neighbor, start walking regularly, commit it to yourself for your health. Then get your children involved. They're gonna come. You're gonna be having some fun, and they're gonna wanna know why you're not stressing over something they did. I mean, we have stress protests. We're not gonna deal with stress. We've learned to manage that by freeing ourselves of all that pressure. It helps us mentally to feel better about ourselves, and we find where we can contribute in our communities. And that was my contribution.
Well, I'm going to absolutely second the need to have community be a major part of healing and of, no one succeeds because of individual effort. Nobody fails because of individual failure. I mean, this is all, I think everyone at the conference has been echoing that point. But as a policy person and a lawyer, I want to say I also think that part of this does come down to how do we support people seeing themselves as part of community. And to me, part of that is Medicaid and other state structures we have that can help support those community-grown efforts to address local mental health and substance abuse issues. But we have a system, a Medicaid system, that allows a lot of flexibility to reimburse a lot of these activities in a way that's effective, and that currently doesn't. I think part of it's the lack of having all the funding under one roof. We have all these sort of competing streams of funding that make the system complicated for a user, for a consumer, for a person who wants to find out, how do I get these services if their child has a developmental disability, for example, accessing mental health or substance use disorder services should not be complicated. Under Medicaid, it's supposed to be something that you can access. So I think that we have some opportunities now, specific ones through a 1115 waiver that Medicaid now has having to do with the residential treatment benefit that I think that we can use to do some of that blending, that we can use to better fund more kinds of practitioners to provide the kind of services that communities need. But I don't think we need to, I worry a little bit about having a system that's so individualized by community that it's not replicable, that it's not really universally available. And that's why I think the Medicaid system is a great place to start and look closely at.
One of the hard things about behavioral health is that people are behind closed doors, but one place where you can find people with behavioral health is in jail and prison. And I think one of the big new generation policies is making meaningful jail and prison reform in two different ways. One of those is just cutting the size of the carceral state. So places like Portugal that have decriminalized drugs, and even Ohio now has a bill to substantially decrease penalties and keep people outside of the system when they're caught with drugs. I think that's really important because it gives people, like drug court's great, but why does it have to be court? Why can't we offer those supports to people before they are in the system and already have something on their record? And the second part of that is offering meaningful behavioral health and substance use treatment in jails. Places that have done that, Rhode Island offers any type of treatment, so methadone, Suboxone, and I'm talking about opioids solely, Suboxone and Vivitrol for people, their choice in conjunction with their physician, their psychiatrist, or their counselor. And since they've implemented that, they've not only decreased overdoses amongst people leaving jail, their entire state overdose rate has decreased because so many people leave jail and overdose. And that's not a fair penalty for someone to experience jail and leave and not be able to find a job and then overdose. And there's something that we can do about that.
Yep, for me, it's just enforcement of already existing state and federal parity laws. Making sure that people who have substance use or mental health disorders aren't denied coverage because of unfair utilization management practices, making sure that we have adequate networks of providers, both for specialty care and otherwise, paying providers enough to make sure that we do have adequate networks of care. So those are mine.
Okay, I will stay quick, but I also had in my notes just to really lift up defending the progress I think that we've made so far, and I know we are so far from perfect, but I think that Alan yesterday, he really highlighted that Colorado has expanded Medicaid, and defending that expansion and making sure that we continue to at least have that like baseline level of coverage and access for folks in Medicaid, and thinking about how do we better, wrap services around if someone is in jail. Do they, thinking about how do we make sure that they stay covered as soon as they get out, that they're able to access treatment as soon as they get out. And then just a really smallish thing that's happening right now is around the Accountable Care Collaborative, one of the waivers that the Medicaid program's operating under, and allowing kids, or actually allowing everybody to get 6 behavioral health visits outside of sort of the capitated rate before they have to go to the designated behavioral health center with a covered diagnosis. And so it's far from fully integrated streams, but it does allow kids then to get those initial sort of behavioral health touches where they get their primary care, and to get, and it allows adults for that too, if someone just needs some brief counseling for grief or other issues that maybe doesn't create a covered diagnosis, but Medicaid's implementing that now. That started July 1, and so I think we all just need to be paying attention to that and making sure that it's being used as much as possible to get folks the help that they need.
In Alamosa earlier this year, we started a LEAD program that's called the Law Enforcement Assisted Diversion Program. And here, this is an opportunity for law enforcement, for somebody who's just busted for having drugs, no violent crimes or anything like that, to take them to a place, and I'm not sure exactly where that is. I don't know if it's Center for Restorative Programs, but where they get screened and see if they're eligible and interested in becoming involved in the program and getting some services that they need. And to me, that's a really great alternative than sending somebody to jail just for having drugs on them. And our jails are overpopulated terribly. And this is a nice alternative, and to give the person an opportunity to come clean with maybe some medicated assisted treatment and the other behavioral health services that they may need so that they can move on with their life and become productive again in our society.
And Tyrone will give you last word.
An elder in the community once said, "The body is not designed to be sick." And the reason why sometimes we face obstacles in this area is because of the violations that we have committed against ourselves and against the environment. And as I think about that, the violation is the culture that we live in. And we talk about policies and practices, but the culture is sick. So if the culture is sick, it begins to perpetuate the sickness in all systems. So if you look at the human body, we have a digestive system, we have a reproductive system, a muscular system. We have all these systems that must work harmoniously for the whole to function at its highest level. In the moment one of those systems are compromised, it affects the whole. And as I look at this, when we work in silos, many of you have already said it, it begins to affect the person. But one thing that we're not addressing in the best practice is the culture. The culture is go to work, go to sleep, or go to school, go to work, go to sleep, go to school, go to work. And that in itself creates mental challenges because you don't have time with your family. You don't have time to yourself. You don't have time to be alive. When I was with Yo-Yo Ma last night, one thing that he said is, when they asked him, how often did you play the cello? He said, I played efficiently, but my father made sure that I played outside and I had a life. And the culture that we have is not providing us an opportunity to live and enjoy the moment and people. And I think best practices are organizations that see the importance of time, that give their employees time off, that have a moment to relax, to have a time to celebrate, and have a time to just be human. And we continuously dehumanize people with the way that we have designed the culture for people to live in. And then we say, why is everyone depressed? Why does everybody have mental problems? Because we have not done a good job creating a culture for us all to live in. And I think those who are doing that, those are the best practices and being more harmonious with the nature that we live in. So that's what I think.
Thank you all again. And as these folks exit, don't rush the stage. Okay, ladies, how about tell us who you are and your organization, and then you can give us some advice. Did you go ahead and start? It's on.
Hello. So my name is Deidre Johnson. I am the CEO and Executive Director for the Center for African American Health. I think...
Don't start yet. We're just going to introduce ourselves first.
Good morning, I'm Amy Cox. I'm the CEO of Community Health Partnership in Colorado Springs.
Hi, my name is Elaine Belansky. I'm the director of the Center for Rural School Health and Education at the University of Denver.
I'm Susan Motika from Boulder County Public Health.
I'm Elizabeth Arnellis with the Colorado Center on Law and Policy.
I'm Priscilla Montoya Vitello from the Latino Community Foundation of Colorado.
And I'm Janina Fariñas with La Cocina, a program of the Family Center in Fort Collins, Colorado.
Okay. So now, Deidre, did you want to start?
Okay. So some of them are just kind of mundane things. Continuing to support and spread what we know works. Continuing to invest in new and innovative ideas. One of the things I've always had a deep appreciation for with regard to philanthropy's opportunity is the ability behind the scenes to get all the players at the table and to really have those tough discussions. Because collaboration works, but it's messy, it takes time, and there's a certain magic to when you get folks at the table putting their organizational issues aside and thinking about the end user, the beneficiary, what's most important to them. And I think my aspirational one is I'm currently on this personal professional journey about community voice and how important it is, whether it's, trying to connect with that young mother with 3 jobs in need of childcare or that senior who's isolated, how can we not only meet their needs, but let them understand that they too have a voice that is equally important? And I'm struck by, these conferences are wonderful, they get larger. There's so much power in this room. And oftentimes people talk about it's time to speak truth to power. But if everybody who's in this room that has their own sphere of power uses that and power starts speaking truth, imagine that. And I love the work that you're doing, and I see the Colorado Health Foundation as one of those foundations that not only talks about health equity, but pursues it. And so to keep continuing speaking truth, but enable others of us in our spheres to collaborate together and have power speak truth, so it's not always people coming to chip away at the mountain.
I'll go next. I would say to the foundation, keep doing what you're doing. Keep listening, keep broadening the tables, the participation and the leadership of the community broadly in Colorado, and the candor of saying not everybody agrees. And I'm going to own that. I'm going to be honest about it. And that's fine. We live in a purple state. Not everybody agrees. But to take more courageous positions, to be inclusive, and then to be honest about what those challenges and difficulties are, I would say keep doing what you're doing. On the issue of behavioral health, mental health, I was kind of up here for the last section because I was thinking, where does it fall? But I would say we need a system approach that is really looking at our broader community. The city of Longmont, for example, or a county approach. How do we bind together people? And we do a good job of looking at best practices, evidence-based. We know what some of the programs are, but what are the communities in America that have really, as other speakers have said, linked community, linked family, linked schools, the key stakeholders with a primary prevention approach and an intervention approach? We can certainly look at the policy levers of the bifurcated or trifurcated system. Absolutely, that's important. But there's a lot of policy work we need to do, and looking at it in a systemic, community-based way. We need the community voice and power. We need this systemic approach which prioritizes prevention as much as the excellent intervention approaches we've heard here today.
And I want to jump in right there if I could. So, much of our mental wellness, our mental health, really doesn't depend on experts. It depends on the everyday, and it's our access to exercise and creativity and food and community. And I come from a parks and recreation background initially, so I always sort of fall back to that. But I was recently traveling in Ireland, and Ireland has a big mental health program nationwide right now. They also have a creative program nationwide. But I was really struck by the fact that everywhere I went, every tourist destination, everywhere I went, there was a message of mental wellness at that site. And so as I think about that, and I think about the assets that we have in Colorado, and I think about the influence, more so even than the money, of the Health Foundation. I think about the influence. How do we use your influence to affect organizations like Great Outdoors Colorado, who's done this Generation Wild about getting kids outdoors, but how are we getting more people outdoors? How are we getting more of our adult residents outside? How do we work with our tourism board? How do we make mental wellness just a casual part of our culture? As opposed to something that's separate. And so I think that, with your positions and your influence, we can take that to a statewide level.
So I want to pull up and sort of build on a lot of what I've been hearing. I mean, first, let me say that taking this conversation, I'm not sure what the next step is that the foundation has in mind to move forward with an action plan based on this conference and what you're hearing. I'm sure there's some next steps, so I'm sure we'll all be looking forward to hearing about that. But I'm going to pull up some and talk about policy as well. So mental health fits in as part of the healthcare system. It has to. That's what we've been striving for. We want it to be integrated as part of a systems approach to health. And when I think about sort of the policy environment, we've got to, as Aaron said, keep our eye on the ball in terms of coverage. Coverage really matters with respect to mental health, and we don't have full coverage. We've made big strides in Colorado, but we're seeing policies, for example, even at the federal level, short-term health plans and others coming that are going to make substantial differences with respect to people's access to health care and mental health care, depending on how we approach this in Colorado. What steps do we take to make sure that we have access to behavioral health going forward? Secondly, as Bethany said, the Medicaid program is an incredible vehicle, but it's not broad enough to cover everybody. And we have a whole population that's outside of the health insurance system, by and large, in terms of our undocumented folks and people who are scared to participate for the various reasons that we've heard. It seems to me that the foundation could really lead the charge in Colorado on changing hearts and minds around inclusion of populations that have traditionally and historically been left out for a range of reasons, including a growing hostility to those communities. The other community where there's a growing hostility, I think, is the poor. We've seen, I think, our national dialogue has sort of shifted to trying to make public programs different in nature and kind, and we're really struggling, I think, with ethics and the baseline investment in public programs in our country. And I think in Colorado that we could be a beacon for continuing to support the infrastructure that public programs provide to make sure that families can achieve economic security and lead productive lives in the way that's meaningful to them. So those are all things I think the foundation can really play an enormous role in. And then the last thing was on communications. I agree the foundation could play a huge role I know you've hired a communications director, and that the message frame about mental wellness is one the foundation could really take on, as well as the message frame around community. Those of us working on fiscal policy, for example, in the state have spent years and years thinking about how to change the frame so that we're thinking about what our obligations are to each other rather than just our obligations to ourselves. And I think those things sort of fit together in a way that would be really enormously helpful if the foundation could think about taking that on. It's a huge lift. I'm very ambitious for the foundation, but I think it's absolutely the direction we need to think about moving in. So thank you.
Hi, Karen. Donald Valdez here from State Representative for House District 62 in Southern Colorado, and I want to thank the Colorado Health Foundation for putting on this symposium, for the education, the communication moving forward, for involving our youth and all of you, because we're going to move this back to our communities, to communities in rural Colorado and throughout the state, but also bringing ideas back to the Capitol to move forward. And I'm more than willing to address those because we have so many issues on hand in our communities, and we need to move forward and educate those in need now more than ever so that next generation continues to lead us. And I see so many here and listening here the ambition to help, and I want to thank the Colorado Health Foundation for all that they do.
Thank you. Hi. So I want to maybe talk a little bit about the idea of how the Colorado Health Foundation could create funding models that directly highlight and directly mirror, I would say, the types of things that we're talking about today. For example, we're talking a lot about integration and siloing. Those two words keep coming up over and over and over again. So the idea of integrated funding streams is also something that I think would be very useful. I run a program that's primarily focused on Latinx mental health, Latinx behavioral health. And in our program, we don't think of siloing out a particular family's experience. We're a 3-generation program. Our families are not siloed, their experiences are not siloed in any way. And so when I have to write a grant that only speaks to a wedge within the program, it makes it very, very challenging for us to take a part of that out, write a grant specifically for that, and then leave a significant segment of our programming out. For us, it would be really important, actually, especially because we are 3 generations, and we are serving undocumented immigrants, which is a population that is completely left out. They have no way to access Medicaid. This is something else that's come up several times. We even serve detainees in the detention center in Aurora, Colorado. So for us, when we start to slice out little pieces, the funding becomes really only mirroring a power dynamic in the community that doesn't reflect the type of work that we're trying to do. So for us, opportunity to be able to bring together and to present together the type of work that we're doing and say, this is how it all connects, this is how it all is integrated, and this is how it all works together. Can you provide some funding that also does that? Would be really important.
I also want to thank you for such a wonderful symposium, and I wasn't planning on saying this, but one recommendation I have is that I hope that you and your staff have restoration after this so that you have the strength to keep on doing what you're doing.
I have a spa appointment this afternoon.
Oh, good. And I would love to see the Colorado Health Foundation take on the issue of poverty, because when we look at the strongest predictors of the quality of our lives, poverty is probably one of the most highly correlated predictors of that. And I feel like that would be getting at the root causes of why we're even having the conversations about an opioid epidemic, for example. So we spend a lot of time talking to people in the San Luis Valley, and one of the things that we hear is this pervasive sense of hopelessness. And when we dig a little bit deeper to find out where that hopelessness is coming from, oftentimes it's because people don't perceive they have economic opportunity. And I really feel like if we could take on that bold issue and try to figure out economic opportunity, a lot of these problems that happen downstream will lighten up. And I was thinking about how if we could have conversations of hope with communities around Colorado about what hope looks like for them, and then see how they're defining it, and then figure out how they want to approach creating hope in their communities.
Hello, good morning. I'm Gwendolyn West with the Equitas Project, and I wanted to take the opportunity to thank the Health Foundation for the tremendous work you've done to lean into inequities that have historically existed and that we're still seeing today. So what we do is we disentangle mental health and criminal justice, and one big contributor to the mass incarceration issue that we have in this country is poverty, and that's come up a few times. Mental health disorders are also criminalized in this country, and I think that as a continuation of the tremendous work that you all have already done toward reducing inequities, recognizing that those who are currently caught up in the criminal justice system or who are returning from incarceration, that those individuals fall into these same buckets that we're talking about, we've been talking about the last couple days. So thank you again for everything you're doing, and I hope that there can continue to be more light shed on the effects of mass incarceration and behavioral health.
So I was going to walk off the stage after this wonderful lady eloquently put what she said together. That was beautiful, and thank you for saying what you said, because that's exactly what I was thinking. And then I was wondering, what else can I say and add to that? And one thing that we did a couple of years ago, so some people ask me my name and say, hey, I never caught your name. My name is Tyrone Beverly, and I'm the founder of an organization by the name of I'm Unique. And the mission of I'm Unique is to create a culture of health, individual growth, and social change. And then in a study that we conducted 3 years ago, we had a lot of conversations around access. People were saying there's a lot of people who don't have access to clean food, to vegetables. And I said, let's put that to the test. So what we did, we hosted an event, and we had food that would be considered nutritious and good, and then we had food that was not. And then we said, let's see what goes first to these people who they say don't have access to it. And then what we found out is the food that was unhealthy is what everyone wanted. But they had access to what may be beneficial for them. They had the access, but they chose something that was not good for them. And then we looked at culture again, and we said, well, what do you eat when you go to the movies? And most people say, I eat popcorn and nachos. I said, okay. What do you eat when you go to a baseball game? Who taught you how to do that? The culture. So culture influences behavior. And if we go to the foundation and we talk about, well, we're working on shifting culture and changing the narrative, that may not work in the grant. That may not work in our proposal. And we say, what's your long-term outcomes? Well, we're working on building a culture, so we may not fit in some of those opportunities because we're not addressing it in the same lens that you may be wanting to see it in. But culture is what influences us all every single day. When you're in traffic, your response, you've been conditioned to respond in an angry way because no one ever told you that you can respond in a different way. But like he said, we don't have the information to say, okay, there's a different way to be alive and live in this world. But our culture is making us sick. And one thing in our teaching we have, it goes like this. When we talk about some of the main causes of disease that we can prevent, because some things in life happen and they're out of our control. But then when we talk about self-care, there's 3 things that we all do. And number 1 is this: crimes against wisdom. And some people say, what does that mean? The first time you drink alcohol, you may spit it out because your body rejects it. But then you continue to consume it and you commit a crime against yourself. And you commit a crime against wisdom. Next one, the abuse of the senses. We indulge in all of these food because of its sensation, the visual, and what we taste. And we abuse our senses. And lastly, the effects of time on all of that has a long-lasting impact on our lives. So those are the things that we can apply to our lives to prevent. But if we put that in the application and we give the information, that may not work. And I think those are some things that we should consider as being more innovative with how we look at addressing community issues, because the way we work and the way we are changing lives may not fit the lens and the narrative in which you want to see it in. Thank you.
Yeah. I was going to say something really similar, and I'm not nearly as eloquent or as well-formed. I think something is wrong. Something is wrong, and we need to spend some time agreeing that we are not okay. Individually, we are not okay. As a society, we are not okay. And we're not having this conversation. Inequity is an outcome of a society that is sick. Mental health issues are an outcome of a society that is sick. We don't spend the time creating connections and relationships with people around us. We don't know ourselves. We don't know others. And so there's this thing that just keeps perpetuating. There's a divide between what we want for ourselves, what we have been told we want, and our natural way of being. And there's an author by the name of Ken Wilber who writes about the evolution of humanity. And we are living in a time in which cognitive science has shown we have developed a frontal lobe. We are aware that we exist. We also are aware that there is something greater than ourselves that exists. We feel it from time to time. If we really tap in those moments that Tyrone was helping us with in silence, we can feel that there is something greater than ourselves. We also know that we are not that. So we exist, we know that there's something greater than ourselves, and we know that we are not that. That's a divide that we need to be able to navigate. We need to have conversations about navigating that together, and I think it all starts with more connection and being aware of the fact that we are not okay and having that conversation more regularly. So it's not about access. It's about deconstructing ways of knowing, right? And then constructing ways of knowing that are healthy and productive and human-centered.
So we are, I'm going to let you speak. We are horribly over time, and in respect for our other speakers, I'm going to let the last 3 people make very quick comments. If you have longer comments, we will stay afterwards and take your feedback still.
I'm Patrick Ortiz. I work with a nonprofit based in the San Luis Valley called San Luis Valley Great Outdoors, and we promote outdoor recreation and health and wellness associated with that. I look at the Colorado Health Foundation, one of their pillars, one of their goals is encouraging policy advocacy. And I think that really starts with the youth and creating an informed constituency with the youth as far as civic engagement, learning about the issues that affect them, and getting involved in the political process, learning about the candidates, learning about the issues at hand, locally, state, federally, and getting the vote out. We need more people voting. We need more people engaged in the political process. And that's where really real change can come from. You know, our country was built upon being a democratic republic, and I think we got to get back to our roots, to those founding fathers and what their goals were, and getting back to creating a real democracy for future generations to be informed and really become empowered to make that change for themselves and their communities.
Yes. So I mentioned before that I work for the state. I'm the director of the Division of Housing in DOLA. And I did want to mention all the great things that are happening and then build on the comments that other folks made. So at the Division of Housing, obviously we're statewide. We have partnerships with Department of Corrections, with the Office of Behavioral Health, and we're providing vouchers in partnerships with communities to house people coming from corrections, from jails, from our mental health, our mental institutions. And so what I wanted to mention was recently someone asked me, where are you seeing the greatest need? Is it with behavioral health, mental health issues? Is it with substance use issues? And honestly, I took a seat back. I mean, you hear who we're working with statewide. And I thought, such a good question that seems like it should be on the tip of my tongue. And it wasn't. So I went back to my office where we have the Office of Homeless Initiatives, where we're working daily with folks to get them into housing, to stabilize lives. And I asked the question, and again, the director of our Office of Homeless Initiative did the same thing I did. Such a good question. And it really is dual diagnosis. Of course, there are people on both sides, but it's the dual diagnosis and having that integrated care so that we can serve the whole person is really, if you can have an impact in growing those efforts and being more effective, because the answer is not one thing, it's the whole person, and that includes serving all aspects of that. So, thank you.
My name is Jamie Dominguez. I just first of all want to thank you. I thought I would never ever be here. I am a community activist. I come from the San Luis Valley. I come from Amara's community. And the one thing I want to say is that don't be scared to invest into new things, because I never ever thought I would be here. I sat down there and I wasn't going to come up for the first two questions or this one, but I need to, because there is power in that. I never thought I would be sitting here and have the time or the place to say, on behalf of my community, on behalf of Amara, on behalf of everybody that lives them kind of lives, that what you are doing is helping. I came here as an upstream member, and I'm helping my team, and I hope we get what we need to move forward in our community. I come from the same place Donald comes from. This is just the awesomest thing ever. I'm a recovering alcoholic, recovering gang member, community member, and apparently now I'm somewhat a professional going to bat for my community with the help of you. Thank you.
Last comment. I just want to say that I think the role of the Colorado Health Foundation is to continue to be bold and courageous and to invest in organizations that are often overlooked and don't have the access for other huge funding sources. So thank you for being bold.
Thank you all. Thank you to everyone that participated. The other two, thank you for all your attention. We don't have a break scheduled this morning, so take a minute and stretch while we reconfigure the stage, and then Erica Snow is going to come up and get us going for the rest of the morning. Thanks all.
Hi, everyone. If you could just take a moment and get seated, we're going to get started. Sarah?
We don't have time to go back.
I don't need it yet. Okay, everybody, we're going to get started. Hopefully you had a chance to stretch. First, before I introduce our next speaker, I just want to thank those of you who were brave and courageous in coming up here and sharing your inspirations, feedback for the future. It was powerful, and thank you. So, round of applause, thanks. So I have the privilege to get to introduce our next speaker, Dr. Jerry Yeager. Jerry Yeager is a clinical psychologist who works with children and adolescents. He is a fellow with the Child Trauma Academy and conducts professional trainings not only here in Colorado, but nationally and internationally. He's also a clinical consultant for Devereux Cleo Wallace Behavioral Health Services, Lutheran Family Health Services, Denver Children Advocacy Center, and the Tennyson Treatment Center for Children and Families. Previously, he was the Director of Training and Community Education at the Denver Children's Advocacy Center and the Executive Director of the Children Denver's Home. Yeager is a member of the Colorado Court Improvement Project and Colorado Systems of Care Steering Committee, and he coordinates a clinical consultation team for the Colorado Department of Behavioral Health. In 2016, Dr. Yeager was recognized as the Child Advocate Victims' Right Partner of the Year by the National Crime Victim Law Institute. And I had a chance to connect with a few of Dr. Yeager's peers, and each of them consistently said, when they thought of Dr. Yeager, they thought of his passion. It's contagious for the work. And they also appreciated his ability to laugh at himself. And in talking with Jerry, he shared that his humor has gotten him in trouble, but he now uses that as a tool in working with communities and families. So with that, let's introduce Dr. Yeager.
So we're in day, what, 3? Is if we're lucky, most of the things have been repetition. Most of what we're hearing is not anything new. Well, I got to go back, but it's not anything new, right? A matter of fact, it isn't about creating something new. It's about remembering something old. Right? We've got to go back and remember that this brain of ours, which really hasn't changed genetically in 200,000 years, was designed to live in an environment that was fairly harsh, that food was scarce, is that it was designed in a way to connect with other human beings. Is that we were one of the weakest, slowest creatures on the planet. And the only way that we could survive is by creating social relationships. And we lived in heterogeneous clans of about 40 to 50 people. We also have been developed is what we're known as we're cooperative breeders. Is that there's not many creatures on the planet that as soon as a child is born, we let somebody else pick it up and hold it. For us, when a child is born, we look down at it and say, you know, he has Uncle Harry's eyes. He has Aunt Jane's nose. Is that child is claimed by the clan. But things have changed in our world. Is that this brain of ours that's uniquely human, we don't have to live in the world as it is. We can actually create inventions that change the world. We can create inventions that this city that we're looking at here is an invention. The clothes I'm wearing is an invention. The concept of mental health is an invention. Racism is an invention. There is nothing that really goes on in the real world other than what we create in our brains that we then take as reality. So, in a way, when I grew up in New York City, I lived in a building that probably had as many people in it than most little towns. But when I walked out of my doors, every adult in that building felt empowered to discipline me. When I went to school, the teacher actually lived in my building. They were part of my clan. So if something was going wrong, it wasn't somebody was doing something to me. It was, let's talk about what's going on and have that person involved in solving this problem. But not everything that we create with this incredible brain is good for us. Is that our brains are still developed within the bounds of a social relationships. Is that when somebody is able to see me, when somebody is able to know me, when somebody is able in some ways to mind my mind, to know me, not what I'm doing, not what I'm saying, but really know me, that condition creates a biochemistry that optimizes my brain to move to the highest levels it's capable of. So that my biology is intimately connected to the people I interact with. My biology depends on people showing up for me. Is that my brain that I'm standing up here talking about didn't get where it's at because I was just born with these capabilities. I had people show up in my life. Some people, in some ways, allowed this to go on. But when we look about what we're creating today, think about the fact that more and more people are isolated. More and more people live in households alone. Our senior citizens, more than any other time on the planet, live in isolation of other people. For the first time, we're under 3 people that make up a family. So if my brain depends on social interactions, can a family really do this alone? When we say, oh, we're going to kind of connect with families, really our invention of families today do not allow a family to do this alone. Is that this concept of community has to take place. Is that children not only are growing up with less and less people in their family, but the average child is spending more and more time interacting with technology. 6 to 10 hours a day, not interacting, what's going to create the biochemistry to allow their brains to be able to connect with other people. Yes, we could solve problems, and yes, we have information, but we're going to have a harder time connecting with other people if we don't make some different decisions. You see, why we've created these new families, structures, why we're giving our kids tools that give information but not create social connections. Our schools made decisions to not really care about social connections, to push for academic performance. But you can't academically perform if you can't use that part of your brain. So that these are decisions that elderly people in our culture throughout history had to make decisions about. What do we want to pass on to the next generation? That's what elders do in communities. They make decisions about what the next generation is going to deal with. So that we know that development requires connectedness with other people. We know that. And we also know that whether we like it or not, we're going to be exposed to adversity. The ACEs studies told us how adversity in some ways directs our developmental trajectories. But what the ACEs studies didn't tell us is that those people who were relationally connected were far less likely to be impacted by adversity. That the biggest adversity we can face as a species is relational poverty. It's feeling isolated and not connected. And so when we're making decisions about where we need to intervene, is how do we not just address financial poverty, but relational poverty? Is that it's within relationships that our biochemistry, our endocrine system, our cardiovascular system, our respiratory system, our immune systems function optimally. Is that we cannot actually maintain our internal homeostasis outside connectedness with other human beings. So that when we begin to increase fear and anxiety through media, when we create fear and anxiety about if I lose something, we're actually hurting our own neurobiology. And when we hurt our neurobiology, we begin to create symptoms. And then we create programs to treat those symptoms. We have bullying programs and substance abuse programs. All of these are indicators of dysregulated nervous systems, that we find alternative solutions to trying feeling whole and healthy. And what we heard up here in all different forms and fashions is that when we create policies that are not disrespected of our biology, but are respectful of our biology, we get better results. When we as elders make decisions and look at our culture and figure out how do we create policies and practice to pass on the things we want to, we will begin to decrease some of this symptomatics in the culture that we live in. And in order to do that, we have to be functioning at the top of our brain. We have to be in a place that we're open to listening. It's very hard yesterday to listen to the stories that those people told us. And what happens is when we're open and we're regulated, we can hear them, we can empathize with them, we can provide support for them. But when their stories overwhelm us, we begin to find who can we blame? Who's at fault for that? Or how can I fix them? They don't need fixing. They need to be seen. They need to be heard. They need to be reconnected. That's what they need the most. But we then have to tolerate their experience. And lots of times what happens in our communities is we have a hard time holding the experience of other people. So that if we really want to make changes, it's not to change the people who are hurting, it's to change us. That's the important thing, right? This guy knew something. He was a smart guy. He warned us. We need to take his warning. The other thing I want to tell you is that our brains develop in a sequential manner. We don't come into the world knowing how to do math. We don't come into the world knowing how to solve complex problems. We do come into the world with the capacity to signal other people that we're in pain, or we're scared, or we're cold. We come into the world with the capacity to connect. Is that our brains are exquisitely designed to change early in life based on the experiences that we have. That we can adapt to any place on the planet. That our ability to adapt is what allows us, and we're most adaptable early in life. Is that this ability is that in the context of relationships, is that the way that we are cared for calibrates important neurochemicals in our body that are going to be important in developing our capacity for motivation, our capacity to be able to think, to organize a plan, and carry out a plan. Those happen within the relationship early in life. They don't happen when we get to high school. They don't happen when we get to be 21 and 22 years old. Our biology is calibrated in the first 3 years of life. And then we build on that foundation. Is that when we look now from a neurobiological way and they hear about how depression changes our hippocampus and impacts our memory. But you know, when you look at psychosis, psychosis changes our hippocampus. When you look at post-traumatic stress, it changes our hippocampus. Really, many of these created, innovative labels we put on people all indicate that it changes our biology and structure. But really, what happened was maltreatment and exposure to adversity early in life is what changes our structure of our brain and the functioning of our brain, which makes us either more resilient or less resilient. So when we start telling people, you're more resilient and you're less resilient, I'm blaming you because in some ways you weren't provided the experiences you needed early in life. So when we begin to create programs, our biology said, how can we support mothers and fathers in their families to provide the pattern repetitive experiences that this brain needs to grow effectively? And how do we connect that family to a larger community so that we begin to see that in some ways the return our investments for making decisions that are biologically respectful pay for themselves? When we keep creating prisons, or we keep creating substance abuse programs, but we don't address what's creating that, we will never, ever have enough money. But when we as elders, just as they came up on and engaged in deep conversation about and listening to what somebody may have a different of opinion, but we listen to those and we then make decisions, and then our policies we create are biologically respectful. The practices we engage in is like, really, is this a new idea to have integrative services? Do you think when there was this community of people that lived together, they had to talk about creating integrated services? They just were integrated. It's an invention that we have specialized so much that we're fragmented. We've invented it. So if we invented it, we can change it. If we invented this concept that certain people who in some ways can't manage what we're all struggling with. You know, we can look at the person with mental illness, but I look around the room, if you were really honest, you all struggle managing the stress of your life. So we focus on where it's breaking down, but it's breaking us all down. So today, I want to kind of use the words that my mentor talked about. When we align our interventions with our biology, we can get significant change. When we are disrespectful, all we're doing is creating symptoms. So the more we address substance abuse, the more there'll be substance abuse. The more we address bullying, the more we've got to embrace and bring those people into our community and hold them and know them. And realize, hey, you know what? When I go home, I'm going to abuse a substance. They're not different than me. I could be homeless tomorrow. They're not different than me. So what I ask is, at the end of this conference, you don't just leave and say, what a great conference, symposium. We heard something, is you take time to reflect. Reflect on your own practices, your own experiences, and ask yourself, this isn't not the Colorado Illness Symposium, it's the Health Symposium. How do we continue to focus away from just treating problems, but really creating health? How do we use our knowledge to begin to create healthy communities that we can come here and have those types of discussions, which is unbelievable because most of the time we're in talking about getting money to run programs to, in some ways, address a problem. If negative experiences can change our biology, what are the positive experiences we need to present to our children and to our community members with enough repetition to create health? Learning about trauma is really about understanding how stress changes our biology. So if we know stress changes our biology, why do we create more and more stress for ourselves? Why don't we start creating opportunities to connect relationally? You heard about nature, you heard about walking. There's incredible ideas out there. Let's really sit down and figure those things out. And finally, how do we align policies and practices with health and not with illness? Those are the things that I hope we leave this symposium with, understanding that really it's about being biologically respectful. Is that, in a way, not feeding other people is not good for me. There's lots of research that when we give charity, when we help somebody else, random acts of kindness, my immune system gets better. So when we connect and come to the table, we're actually not doing that because we're helping somebody. We're helping ourselves. And when we help ourselves, we help all of them. So in order to help ourselves in the last 3 or 4 minutes I have with you, I want you to take a moment before you leave here to realize that you have been in the presence of other people who do not value their success based on having a big house, having multiple cars, but you're in a group of people who value their success on whether they can help other people. That is very unique in our narcissistic culture. So before you leave here, one is take a moment to recognize what a special person you are. That you come with a mission about making the world a better place for other people. And feel what it's like to really value what you do instead of what you haven't done or what we need to accomplish. Take a moment to recognize how special you are. And before we leave here today, I challenge you to go and connect with somebody else and say, thank you for showing up. That is connectedness. That changes our biology. Thank you for taking time to show up, to engage in these important discussions to improve the quality of life for others. That's really what this symposium is about. It's about really rejuvenating ourselves, re-energizing ourselves, and reconnecting with others in our community. Thank you very much.
You guys were the first to get a glimpse of that, so I appreciate that applause. We're so excited about that project. And so excited to be here today. Thank you so much to the Colorado Health Foundation for inviting us, me and my storytellers, to tell our stories of resilience and what it means to be living successfully with a mental health condition. So I'd like to start off with a question. So have you ever thought about how our lives and our relationships and our world even might be different if we stopped being so afraid of stigma? What if instead of hiding what we've gone through, we instead looked at all the struggle we've been through, all the pain, and found a way to turn that pain into power or even purpose? And so what I'm going to share with you today is my story of the pain and struggle I went through as someone living with bipolar disorder, and how I turned it into something that could create change. So, has anyone here ever found themselves in police handcuffs? Raise your hand. A couple brave souls raising their hands. It's not something we want to openly admit, but I was in police handcuffs 8 years ago. And if you would have been with me on that evening, you would have seen the look of fear and worry and concern on my mother-in-law's face as she walked in the door to help with our 18-month-old son. You would have seen a very different version of me because I was in the middle of a manic episode. So I had these thoughts and ideas racing through my mind so fast, I couldn't latch on to anything. So the words coming out were not making any sense at all. And I had this outrageous amount of energy, but I had barely slept all week. If you would have been with us that night, you also would have seen my husband, Ben, looking calm and collected, maybe on the outside, but on the inside, I knew that he was probably a little bit disappointed and even maybe scared about what was going to happen. He had been through this with me before, so he knew by the signs I was exhibiting that he was going to have to call 911. And so he did. He called 911, and next thing I knew, police officers were walking into our bedroom where I was sitting on top of the bed, so excited that I had an audience all of a sudden. I couldn't wait to tell them the news. But they were perfect strangers, you know? They were police officers, but I was still so excited. And they started asking me questions about my mental health, my bipolar I diagnosis, and whether I was going to take the medication. And I told them, no, are you kidding me? I know what's best for me. I'm not taking those meds. And they told me in that moment that they had to take me to the hospital. I remember the officer standing in front of me, one standing behind me as I was placed in those handcuffs, the feeling of cold metal against my skin, the sound of them being tightened, and the weight of them pulling my arms down. I was led outside our bedroom, down the hall, past my son's room, where he was sleeping. And I said in my altered state of mind, wait, we're not gonna wake him up? He loves police officers, come on, we gotta wake him up and introduce you guys. This is great, you're in our house. They didn't listen. I was placed in the cop car that was waiting at the edge of our driveway to escort me to the emergency room. The doctors and nurses who saw me knew right away that I was in the grips of mania, but as usual in our system, we had to wait for a bed to open up. So that night I was handcuffed to the triage bed in the ER as we waited, and in the morning a bed was located. I was taken again via cop car to the psychiatric hospital, where I proceeded to walk the hallways. I was in this frantic state of mind, you know, the mania has catapulted into psychosis, and every time I walked past the nurse's station, they had this potted plant, and I would grab a flower every time I mutilated that plant. I'm walking through the halls, pulling the petals off the plant, saying, it's a boy, it's a girl, it's a boy, it's a girl, it's a boy, until finally the staff had to hold me down and administer antipsychotics via injection. They had to bring me down from the mania. So I went back to my room, I slept hard for a day, And when I woke up, I started back on my treatment plan. And at the end of the week, it was time for the commitment hearing. Because I had been involuntarily hospitalized in Virginia, we had to hold a hearing to determine, is she well enough to go home, or does she need to stay longer? And so I'm taken again in handcuffs from this hospital to a government building, and my dad and my husband are there to meet me. And we're sitting there waiting in this room, and I'm still in the handcuffs, and talking about my progress over the week. And you know, I was ready to go home, but we had to have this, they had to hold this hearing. So we're sitting there waiting, and my dad, sitting right across from me, pulls his cell phone out of his pocket, and he said, "Jen, I want you to promise me you're never gonna go off your medication again. You're not just gonna have one baby to take care of, but two. You're pregnant, and you need to take care of yourself so that you can be there for your kids." And he took a photo of me in handcuffs. And I wish I could say I have that photo today. I don't know where it ended up, but it's ingrained in my memory, and I've kept that promise. So I was released from the hospital. I get home, and in the weeks that followed, I had these emotions just crashing over me. There was shame and embarrassment and humiliation, but worst of all, there was isolation, because I felt like I couldn't talk to anybody about this. I mean, it's not like I'm gonna go to a play date with my little toddler expecting, saying, "You thought your first trimester was hard, I was in handcuffs." It's not like something you're gonna bring up. So I kept it all inside, and I struggled. And I didn't know at that time, but it wouldn't be long before I would be sharing my story publicly, and I would be encouraging other people to do the same. So my mental illness emerged actually 5 years prior to that episode I just described. I had been working a job that I loved. I was a recruiter in downtown DC, making 6 figures at the top of my game, had married my college sweetheart, and we were building a house. Life seemed like it couldn't be more perfect. But then all of a sudden, everything came crashing down. I had a week where I didn't sleep. I was very stressed at my job. I was working late every night, and my husband had been out of town that week on business. So he gets home on Friday and knows immediately that there is something wrong with my wife, but he didn't know what, because I had no history of mental health issues. So he tried to calm me down that weekend, but you can't calm a person down who's going through a manic episode. They need medication, they need treatment. So he found that out by the end of the weekend when he had to call 911. And that was my first time in the hospital. I got out of the hospital and saw my first psychiatrist, who told me, took my whole history and said, "You know what? It was all because you didn't sleep. De-stress, take a week off work, and you'll be fine." But I wasn't fine, because 2 weeks later it happened again, and I was hospitalized on Christmas Day in 2005. Coming out of that second time, we knew right away that this was serious. We needed to figure this out, and I was thrown into this world I knew nothing about. I saw psychiatrist after psychiatrist. I saw therapists. I had mood charting. I had medications. I had side effects, and it was extremely overwhelming. I tried to go back to work, and I could no longer function under the regular pressures of the job. So I made the difficult decision to resign. And in doing that, I spiraled into a severe depression that lasted about a year. I, again, felt that isolation crashing around me. You know, I had no one to talk to, and I just wanted to be normal. I didn't want to be going through this. And so I built this wall of protection around myself, and I didn't talk about it. Looking back now on that time in my life, what was happening to me was stigma. I was, stigma, I was afraid of talking about it. Stigma makes us afraid to talk about our depression and anxiety because we fear that people will call us weak. Stigma is saying you're at the dentist when you really had a therapy appointment. Stigma is what causes us to internalize these struggles we go through because we fear that we're going to be treated differently or looked down upon or discriminated upon. But what I found through the work that I'm doing now is that stigma lies to us. And that slide advanced all by itself. So basically, what happened then was I ended up getting well. I got through that horrible year. At the end of that year, it was 2006, I call my deep, dark year, cried every day, slept every day. I wanted to sleep through that whole year. I had a med change and had suicidal thoughts, and thankfully recognized that I needed to tell someone, told my husband, told my doctor, and I got on a different path. And luckily then the next med was the med that worked for me, the one I still take today. So I got through that horrible year. I never imagined that when I would go to have my children, I would find myself handcuffed and hospitalized against my will, but that ended up being my reality. So for those of you keeping track, that was 4 hospitalizations in 5 years. And when I was able to look back on that whole period of my life, those 5 years, I realized that I didn't just go through all that hell for nothing. I said to myself, find a way to turn that pain into purpose. And I didn't know how I was going to do it. I had no idea when it would happen, but I just knew that I wanted to write my own brave ending, as one of my favorite writers and speakers, Brené Brown, says. So, in trying to make sense of everything I had gone through, I found something that would change the course of my life, and it was something as simple as stories. I would look to the internet to find people who were blogging about their stories. And these writers were writing so openly and honestly about what they had gone through that they inspired me. And so in 2011, I wrote the first post on a blog that I titled Bipolar Mom Life. And it was, what I wrote about was managing bipolar disorder, raising my kids, and just life in general. And it was very therapeutic. And when I started the blog, I wanted to be open with my true identity from the start. But I had asked my husband, my parents, a few close friends, even my psychiatrist, what do you think? Should I do this? I really want to just be open and use my real name. And they all said, don't risk it. There's too much judgment out there. People will treat you differently. They'll look at you differently. Don't. So I wrote anonymously and safely for 1.5 years as just bipolar mom. Until one day an editor from the parenting website What to Expect found my writing, that book when every woman gets when she's having a baby. They said, we want you to write for us. And I said, great, what do you want me to write about? And they said, being a mom who has bipolar disorder. I said, great, that's what I know. And in that moment of being recognized for writing about something that not a lot of people were writing about at the time, I made the decision to stop hiding. I said, ready to say, screw you to stigma. I don't care. And I want to make a difference. And if my story can help just one person, it will all be worth it, worth the risk of being open. And so it's at that moment that when we're ready to put our names and faces on our stories, we cut stigma out of the picture. We take the power away from stigma. If we look back on history, at any movement that's worked to end discrimination, you find true people telling their true stories with their real names. You see these figures. So I felt like it was time. It was at the same time that the song Brave by Sarah Bareilles hit the radio, and I fell in love with it. So I just played it on repeat, and the one part of the song that hit me the hardest was this, the lyric that said, your history of silence won't do you any good. Did you think it would? Let your words be anything but empty. Why don't you tell them the truth? And so I felt so brave, I tweeted to Sarah Bareilles, and I said, this is how big my brave is. And I included a link to the first time I wrote openly with my real name. And she retweeted it, and I think my neighbors down the street could hear me screaming. I was so excited. So that was kind of the start of it. At that point, the the What to Expect folks took one of my posts, one of my very first posts openly, and they put it on the homepage of AOL. AOL had owned that property. So that was not my title, they titled it. But it got a lot of clicks. What landed Mom in the psych ward? So people in my community who didn't know my story reached out to me. People in my life, my family members who didn't know the whole story because I wasn't open, reached out. And they said, thank you for being so open. Thank you for telling your story. And then in the same breath, they would turn around and tell me their story. So in the back of my mind, I'm thinking, there's something to this. There's something here. And so this is where I came up with an idea to try to prove how stigma lies to us. So I met a woman in 2013 who ended up becoming my co-founder, and she shared my passion of mental health awareness and getting our stories out there. And I told her, I said, I have this idea. I want to launch a project that will become a platform for people to share their true personal stories live on stage in front of a live audience through creative expression. And I want to do this, and I need help. And she said, I want to help you. And so we launched it on Kickstarter. And it was just a concept. It was just an idea. And we put it out there and said, we need this money to raise the funds to rent the theater and to do the marketing. And we raised over $10,000 in 31 days because people believed in this. We sold out the theater after we had casted the show. We put out the call for storytellers, met 14 incredible people, and then put on the show, sold it out, covered in all the major newspapers and TV networks in our area. And people said, all right, what's next? You know, we want you to keep going. And so we became a nonprofit organization that same year in 2014 and began our vision of expanding across the country. And to date, this is my bravest held 45 unique shows in cities across the United States. And we've had a couple done in Australia as well, with over 650 people who have shared their stories on our stages. So it just goes to show that there needs, thank you, there needs to be an outlet. There needs to be an outlet. And we see the same thing happen at all of our shows. I had some press coverage in there. We were at front page of the Washington Post 2 summers ago, and we hit Oprah Magazine 2 summers ago. This was a 4-page feature article that they teased on the cover, I'm not okay and that's okay. They came to the show, not Oprah, she sent her editor, but, and they did this 4-page article, The Healing and Revealing, and then they shared it online with the title, The Powerful Way These People Are Coming Out About Mental Illness. So that was really neat for us, and that really helped launch us to go to many more cities. But the same thing happens at all of our shows, and that's that connection that the audience feels with the storyteller on stage, because when you see one person being vulnerable and telling you about their darkest moments, then you feel the courage to then open up in return. And so, for example, the first show in 2014, I walked out of the lobby, I'm hugging my friends and family, there's a lot of tears in the audience, or in the lobby, people are connecting. This one woman said, I drove all the way from Philadelphia to see your show here in DC. She said, I found your blog in my darkest moments, and your writing saved my life. And when I heard that, we hugged. I mean, I'm still in touch with her today. She now is about to have her second baby. You know, these people, there's a connection. When we put these stories out there, there are these little life rafts that when someone's struggling and they're searching YouTube or searching online and they find a story of someone they connect with, they feel that sense of hope. And this woman is Kim from Canada, who was one of the original bloggers who inspired me to share my story. So really what this all comes to, I'd like to kind of wrap up with this, that recovery is not a straight line. So my last episode happened, well, the last one I described in this talk happened when I was pregnant with my daughter in 2010. But I had a recent episode last fall. My co-founder, Anne-Marie, tragically passed away from a heart attack at the age of 59. And when she passed, I went through a manic episode and had to go to the hospital. And it was very hard. But the thing that keeps me going are the people that I've met through my work, and I am very blessed to have a strong support system around me. And I will mention, too, that when I did get sick that time, my kids saw me go through a manic episode very briefly before my support system kicked in, and my husband called my best friend and said, I need you to grab the kids. She came and grabbed them, and my in-laws came and helped take me to the hospital. Very different than going in handcuffs, I'll tell you that. So recovery is not a straight line. You're gonna have ups and downs, and that's the thing. What keeps me going is knowing that this work we're doing is very important and that we are helping to save and change lives. And so we keep it going because our vision is that one day we'll live in a world where we don't have to call it brave for talking openly about mental illness. We'll just call it talking. So thank you guys so much for having me. Thank you. Yes. Thank you so much.
Well, Jen, thank you so much for talking with us this morning.
Yes.
We were talking yesterday a lot about the power of storytelling, and just really interested in you sharing with us kind of why you think there is this experience that happens between the audience and the storyteller.
I mean, someone once described it as magic who was in our Philadelphia show, one of the storytellers. I just feel like it's, like I described, it's this connection. I'm hopeful that my story resonated with each of you in the audience in some way, whether it be that connection of, you know, going through something as a family or just, you know, deciding to be open and share a story. I feel like it's just this mutual vulnerability. It's when one person is vulnerable, others feel an invitation almost to be vulnerable as well, and that's how we make these deep connections.
So we were talking a little bit about Brene Brown and her description of vulnerability and what it means for folks to be vulnerable and for people to listen. Can you talk a little bit about that and how it inspires you?
Yeah, I mean, I've been a fan of her work for so many years. Back, you know, she did her TED Talk, her big TED Talk, and she's done several, but one of them she said, you know, she had been watching the conference over the past couple days, and then it was finally her time to get up and speak, and she said, you know, everyone gets up on stage and they're talking about these vulnerable moments of when they had a failure or when they, you know, had some issue in their life that they had to tackle. And she said, we could call this the failure conference. And it's when you can be true and talk about what enabled you to get to where you are. I think that really, as she said, vulnerability is our most accurate measurement of courage. And she put it to the audience and she said, how many of you, you know, when you saw those speakers up on stage, thought they were weak? No one raised their hand because, you know, we have this untrue picture of what weakness truly is. I mean, I don't know.
Strength, right?
Yeah.
It is about strength and getting up to share your story with folks. So over the last 3 days, we've had a lot of different folks sharing their stories with us with a variety of perspectives. And one of the things that I was struck by, I am from a family of storytellers. And so I have been listening a lot over my life and really come to understand the connection that we can all feel from storytelling, but that as we listen, we all usually listen with our lens, whatever lens we're bringing. And so what we truly hear sometimes is not that intended message of whoever is sharing their story. And so I'm interested in since we've heard from so many different folks sharing stories, what advice you have for us about how to truly listen?
That is an excellent question. I think that what I've learned over the years about listening is that, and I'm not an expert by any means, but I think it's just listening with intention to just listen, to not judge and to not offer advice. I think that's what I struggled with for a long time, and I'm getting better at, just taking it in, hearing what they have to say, truly hearing what they have to say without offering a Band-Aid or well, have you tried this? You know, because that might not be relevant to their journey, you know? So just really hearing them out and then maybe saying, how can I help? You know, can make a world of a difference, I think.
So you've talked a lot about your 2 kids, and I am the mother of a 3-year-old, and I am still figuring out what in the world that means and how it influences my life. And everybody talked about the terrible 2s, but the terrible 3s are a thing, y'all. It is a thing. So I'm really interested in, as your viewpoint as a parent, kind of how that impacted you as you thought about sharing your story.
Yes, and I shared with you last night how when I first was trying to make the decision of going public right away with my blog, when I launched it, my mom said, what do you think the parents at your kids' preschool will think? What if they don't want their kids to play at your house because they know you have bipolar disorder? And, and my dad said, why do you have to be public? Why can't you just write anonymously? And I just wanted to be real and true to myself. Like, this is a part of my life. I think of bipolar disorder every day. I take my medicine every day. I think of my self-care, not as often as I should, but most days. And I think it's important that one other thing she said was, how can you make that decision for your kids, that you're going to be open about it and you're not even giving them the chance to weigh in on that? Because at the time they were 1 and 3. My kids are now 7 and 9, about to turn 8 and 10. And having gone through that episode as a family, I'm very lucky that I have a very strong support system around me. And my children, it was traumatic for them to see their mom not well. And we are very fortunate to have the resources to be able to have them in therapy. My daughter went through 5 months of therapy, and my son is now in his 2nd month. And because their trauma surfaced after the fact, and it's so healthy for them. Like now, and my kids have been around it since I started this work. So, but I think that they're very proud of what I do, and they are proud, I think, of their own mental health, the fact that they're learning so much in therapy. And I think it's important to show that mom and dad can get sick sometimes, and our mental health can suffer sometimes. And I think that it's okay for them to know that mommy has to maybe go to the hospital for a little bit, and she's going to get good care, and she's going to come home, and she'll be back to being mommy. And that's how it is. And I think it just is changing the generation, and the way that generation looks at mental health, I think, is going to be completely different than our generation, how we've grown through it and how we're hoping to really change it. I think we're starting younger, and I think it's good.
So speaking of generations, so yesterday we met right after I was coming out of the podcast booth, and yes. I was a bit emotional. And one of the questions that was framed to me was around kind of the next generation and our youth, and this notion of them being brave. And you just ended your talk with this notion of us being brave. Talk to us a little bit more about being brave, but really trying to change that to just talking and making it something that we do every day.
Yeah, I mean, I think that bravery is, doing something you might be afraid to do, right? So I think that there might still be some element of brave. I hope we don't have to rebrand our whole organization, because I like our brand. But I think that just normalizing the conversation, I think that's what I'm getting at when I'm saying that one day we'll just call it talking. I mean, when you think of, in one of my versions of my talks, I talk about being at a coffee shop with a couple of your friends, and like the one friend might have the flu, and the one friend has an arm in a cast, and the other friend has diabetes monitor they set on the table, and the other friend lost their hair to cancer. And then the 5th person sitting at the table is sitting there suffering in silence with severe depression and suicidal thoughts, because it's an invisible illness for the most part. Why can't we make it visible, and why can't we talk about it openly? And I think we should be able to celebrate it. We should be able to celebrate recovery. I am so proud of all of the people that I know in recovery that work hard at the recovery every day. And I know how hard that is. And I think that what our shows do is really celebrate that and show that you can tell your story in different ways, because it's very creative. And you're going to get to see some of our creative storytellers too. So,
And speaking of those creative storytellers, why don't you talk to us a little bit about how you all recruit folks to share their stories and what the process looks like, and how you think about the diversity of stories that you all are sharing?
Definitely. So when we first started, I remember my co-founder, Anne-Marie, said she was a little less, what's the word? Confident. We were going to get the storytellers we wanted, but I said, let's just trust this. Let's just do it. And we put it out there, and the people that came forward were just so talented. And that's what happens every time. We go to a new city, we're going to do a show. We have a volunteer producer who offers their time to bring it to that city, and they put the call out for storytellers. And we put it on our social media. They put it in their community. And we say, we want to hear your stories. And then they do 2 days of auditions. And we have to call it auditions because every story is important, don't get me wrong. It's that we have a limited amount of time with the show, and we need people to be completely prepared with a piece that they've really thought through and that they've really kind of polished. So they come and they tell their stories, and then we select a cast of about 14 or 15, give or take, and those stories are selected. Again, every story that comes forward is important, but we select those stories based on that diversity, the diversity of backgrounds that people come to us with, and the diversity of types of stories. So we can't have a show that's all about depression, because that's not the true picture of mental health in our world. There's PTSD, there's OCD, there's trichotillomania, there's eating disorders, there's so much, you know. So we want to really tell so many different stories so that when you come to one of our shows, you are getting a picture of what's going on in communities everywhere.
As we prepare to hear from our two storytellers, what advice would you give to us about how to listen?
To listen to these guys is such a it's a privilege to hear these stories. And so I ask that you keep your hearts open and focus on the words, focus on the lyrics of the song, focus on the verses of the poem, and just let yourself feel what they've felt. And I don't know, I just feel like if you can focus and listen with intention, you're in for a treat. You're going to get a lot out of it.
Would you like to introduce our storytellers?
I would love to. So I have a quick little intro for Jovan that I'm going to read from my phone because I don't want to miss anything. So Jovan, he was a part of our very first show in Denver. We've had 2 shows in Denver. He's a National Poetry Slam champion and the Emeritus Poet Laureate of the City of Aurora and the Youth Voice Coordinator of Aurora Public Schools. So please welcome Jovan.
Thank you. It's interesting, you know, I don't know if it's because I kind of grew up in the African-American community, but also in athletic communities that, you know, talking about, you know, your struggles was just never a really popular thing. I remember one day I tried, I really tried. When I was in high school, my best friend committed suicide. I remember I tried talking to my dad, and my dad was like, "You'll be all right." And I remember just being like, I don't know. I don't know if I'm gonna be all right, Dad. You know, but not knowing how to necessarily express that. And right around my senior year of school, I started visiting of college in western Nebraska, where I went to school at Shadron State College. I started visiting with my therapist, and that was my first kind of understanding of like, oh, holy crap, it feels good to be heard, you know? And I just remember walking a little bit lighter when I left that space. Several years later in my life, I kind of went through some traumas of some sorts, and I went to my therapist, a new therapist here in Denver, and you know, told him about my situation. He said, well, I want you to imagine
all of the yous in one room. And I was like, dude, what are you talking about? You know, and he's like, you know, all of the yous, you know, the yous that struggled at certain ages, the yous of the future, all of the yous are in this one room, and they're all hanging out, and they're kicking it. They're having a great time in this giant, you know, warehouse of a space. And then in the middle of this space, a bomb goes off. Now, who are the yous who didn't survive this issue that you're going through? Who are the yous that were wounded by the shrapnel? Who are the yous that only heard something and ran away? Who are the yous that somehow stood right there in the midst of everything and were okay and stood strong? And I started thinking of who that you was. I spent so much time thinking about this. And this you ended up becoming this 8-year-old version of myself. And this 8-year-old version of myself is a really interesting kid. It all kind of came to fruition with This Is My Brave. And when the producer asked me to be a part of the show, I remember being like, well, I really don't have like a mental health issue. Like, I don't really like take medicine or nothing like that. So I might not be your person. And she was like, Jovan, really think about this. And I started going back and remembering this time in my life when I was in 3rd grade. And I lost 3 grandparents over the course of 5 days. And they were all over the country. And they were vastly important. Particularly, like, my dad's mom was the person when I was in 3rd grade when I started writing poems who was like, Jovan, you're the best poet in the whole wide world. And I'd be like, yeah, Grandma. She'd be like, yeah, right? And so I have this big pencil up here with me because this sort of represents who I was. You know, this kid who saw writing as like a real belief system, like that I could write my way through anything, and that everything that I put together was dope, and it wasn't dope because like of anything else. It was dope because my grandma said it was dope, and she was the only authority that I needed on that, right? And so I came back to the producer of the show, and I said, you know, I think I might have something, and what it came out into the incarnation was this Fisher-Price toy box that existed in my room. Maybe you remember this very high, like, Kmart thing. There's thousands of them. They're white sides with like a blue lid and a green front. And when this time happened in my life, I started taking up homage inside of this space. And exclusively for the greater course of a year, this is what my mom and my dad told me. And they said, we didn't really know what to do. And I'm like, well, y'all could have took me to a childhood therapist, but okay, y'all just let me sit in a box for a year. That's all right. That's cool. I guess that's how we're doing it. Like, he's okay. To the degree, like, or like, even at like family dinners, they would just move my box down by the table and, you know, and it was cool, but it was like this thing that like, I guess this space where I kind of felt okay. And so I wanted to write a poem about this sort of space and this existence, and this poem's called From the Toy Box. And this poem's kind of like a dedication, and whenever y'all are ready for the music, I'm ready. This poem is a dedication to anybody whose childhood trauma really impacted, you know, their adult trauma in a way. And this was my way to figure out a way out of wanting to die, was needing to lean on my inner 3rd grader to figure out a way to survive. And I hope that you remember those younger versions of yourself who had to survive and you forgot how powerful their survival was, and they can help you. Here we go. It's one of those days again where I'm 2 sides. Suicide not subsiding, and this other side barely siding with me. I'm a tornado, losing all of my siding, a scaffold sliding, wondering which side of the gun, which side of the drowning, which side of the fall, the Super Soaker or the Glock, the imagination or the water, the parachute or the plummet. You see, somewhere in this gun locker of a man is a chest evacuated of toys. Deep inside this knocking engine was a room in Aurora, Colorado. Innocence, in a sense, losing all of its sunshine. There's a frame exposed with an 8-year-old black boy in the middle. See, it's 1994. Nappy head, grass stains, torn jeans, wrestling action figures, football player posters, teenage turtle sheets, and probably too much booger and butt picking to count. But slowly and ever so surely, his house is melting. There's a tornado of hands, and everything is too fast to grab. He's wondering why everything is ticking, flickering and fading. He's wondering where his history is going. There's a storm warning for a green sky. 3 grandparents, 1 week, 3 fallen sequoias pounded his tectonics phonics until it was just rattling. 3 cross-country trips, he and the other 3 in his house silent. An aftershock astronaut with a knot in his throat and a knot again on his little boy tongue, traveling the speed of knots, crashing against the waves. 1, will Granddad and I still go fishing? 2, singing for his grandma, dim, 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 the dim, 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 as the light dimmed from her face. And 3, a phone call. Nana didn't wake up out of her sleep. The woman who taught me poetry and everything I needed to know about being brave. And the house evacuates like floodwater, leaving you inside. Here he flees to his real home, his life raft, the toy chest, where escape was possible, where he could sing dim, dim crayon songs until darkness dimmed into fluorescence, where he could dream them back. He could set some hooks and take proud pictures with Grandpa, pull the sheets over and call his Nana, and get sat down and laugh a map into a bucket list until glimmering limericks fell from her wrinkles. And I'd say, Nana, and she'd say, I told you, they're everywhere. And poems were just petals on casket decorations. See, this boy, he knows coloring book scripture, deshelling Silverstein till his thorax lorax back onto their laps. From the doctrine of Seuss in this cube. When I stand on 2 sides, y'all, suicide not subsiding, and this other side barely siding with me, a boy peeks out from the toy chest laughing. He stands proud in cowboy boots, whitey-tidies, and ashy knees and invites me in. Says, Jovan, we're all in here. You always try to oversee us. So Jovan, wake up. Jovan, get back here. Jovan, I love you. Jovan, I know storms. How they swoon and swear. How everything feels upside down in its wake, but pull up a crayon and tell me a story that no one knows but us. A secret we both share. That tomorrow wants you. Daytime is draining. Nighttime is hungry, but chests, Jovan, chests are not caskets. It's just the home that your heart rests in. And boxes are just houses, and yes, houses can be haunted. But in this house, the ghosts are with you. Thank you.
Am I on? Okay, real quick. Wasn't he amazing? The talent. So we have one last storyteller for you, Amanda Gold.
Amanda is happily lost in exploring the mystery of love in action. She's a full-time student at Naropa, a creative force in several mediums, and loves high fives, hugs, and corny jokes. She's so happy to be alive and here with you today to share her music and her story. Please welcome Amanda.
Hello. That poem rocked me. But I know that we're in a safe place to feel these kind of emotions. So thank you, Jovan. Give me a second to collect myself. I'm going to set this guitar down, and then I'll share some love with you guys. 1 second. I've heard that this has been a really beautiful conference, but brings up a lot of emotions. So you guys have done such a good job of preparing with the water and the tissues and the love and the welcoming. I'm really grateful to be here. It's been so good to meet Jovan and be included. It's been just tremendous to meet Jennifer, Jen. I hope that we're friends now for sure, so I can call her Jen. And just this organization, this foundation, everyone has been amazing. The Sarahs, and thank you. I'm happy to be here. All right. So I'm going to play a song for you that I initially wrote for myself. I was practicing for my buddy Michelle the other day, and she said, "Ooh, it sounds so joyfully desperate." And I liked that, those words together, and I thought, yeah, that's kind of been the theme of my life. When I wrote the song, I was a homeless alcoholic, and to add a little bit of spice, I was also a heroin addict. Things were really dismal, and I used to sing in downtown Denver for spare change. I was exhausted and humiliated most of the time, struggling with abusive relationships. My guitar wasn't the only thing that was falling apart. I'd been depressed and suicidal since the 5th grade. I was horribly insecure, sad, and terrified for as long as I can remember. I know it wasn't all bad. I know that. I understand that everyone did the best they could with what they had at the time, but I went through a lot of abuse, trauma, and neglect. And as I grew, I felt less able, less capable of feeling joy, and more desperate. By my early teens, I was cutting myself. I was experimenting with other forms of self-harm. I was obsessed with death and dying. I was hanging out in cemeteries. I was burying dead birds and digging them up again. I was taken to a few therapists, but no one got to know me. They were just these experts that knew something was wrong with me. They couldn't agree on a diagnosis. They just all agreed that I was messed up. Around the age of 14, I was hospitalized for 2 weeks, and that also did much more harm than good. When I was 15, I ran away from home, from people who hit me, from people who were supposed to take care of me but didn't know how. I was also running from myself. I get that now. I was so fed up. I hated myself. Why couldn't I just be happy and normal like everyone else? That's a lie, right? Like, we all struggle. But I thought everyone else knew the secret that I didn't know. So I found drugs and alcohol, and I took them all the drugs, all the alcohol. I took it like I had something to prove. And I thought I figured out a brilliant loophole. Everyone told me, they were scolding me, like, you can't kill yourself. You're going to go to hell. How could you be so selfish? And I was like, I cannot live with this feeling. I have to find a solution. And for me, that was drugs and alcohol. It was like, if you want me here, you've got to take me like this. Here I could drown my shame, my sorrow, my loss. I found where I belonged, I thought. I thought I had found freedom in a bottle, in a needle, in a pill, in a shot glass, in a rolled up dollar bill. I used as much as possible, as often as possible, but from the very beginning, I know I was never in control. And when the drugs wore off, I was still me, still stuck and still hurting desperately. I knew joy existed, I had seen it, but that just made me feel like I was even more of a failure because I couldn't hang on to it for a long time. Everything got worse, but I didn't know how to stop. Every time I woke up from another party, another blackout, and overdose, I felt confused, and I was relieved to be alive, but I was also so resentful that I was still alive. Wash, rinse, repeat. For 16 years, I did this, till finally I broke down. I didn't even know there was help for me. I didn't know how to ask for it. I just broke down, and luckily it was in front of someone who understood, and she guided me. She didn't judge me, and she led me to recovery. So, back to the song I'm about to play for you. Actually, no, you know what I want to say before I play this song? As beaten down as I was when I started to understand that there was a chance for me to survive, in that moment of desperation, I found out there was still joy. In the form of that still small voice, you might have heard of it. You know the one that says, shh. It said, there, that's enough now. It told me to stop. And it said it was time to come alive. So the song I'm about to play for you, it's a happy song. I did write it when I was so lonely I felt inhuman. I was also all I had. So one day in that joyful desperation, I sang to myself. And there was a teeny tiny little part of me that thought I might be worth saving. I hardly believed it, but sometimes I did. And so I kept on keeping on, and it didn't make sense why I would even bother at that time. But now I'm so grateful that I stuck around. Today, I sing the song from the other side with new eyes, with a new perspective, with new love in my life and in my heart. I am running out of time for this talk, but I have pages and pages of gratitude to express, and I could get emotional again. Recovery is a journey, and I thought the hard part was going to be to detox and to get rid of the chemicals and the substances, and that was really hard. Ask anyone in the underfunded, overcrowded detoxes that tried to help me. I was the patient from hell. It was the worst they had ever seen a lot of times. But that was just the beginning, and the real work is continuing to face those demons that led me to the drugs and alcohol in the first place. And I couldn't have done that alone, and I don't do it alone. And it makes life so rich and rewarding today. I have so much support from strangers, like people that I just met that I feel connected to immediately. From my therapist, who I've been seeing for 4 years, Lisa. She's wonderful. She found a way to help me that no one else could. The people that led me in 12-step recovery rooms, my family who accepted me back even after I had just destroyed any possibility of that. So I hate cutting out the gratitude, but I guess I can leave you with the idea that gratitude just grows and grows and grows. And I did spend more time in this talk on the bad stuff, but that's done. That's over. That doesn't have to be my story, and it doesn't have to be the story for anyone here. We don't have to let our past define us, I guess is what I would leave you with. So, there's a lot more pretty stuff I wanted to say. Maybe I'll get a chance to do it in another speech. For now, I will just play the song for you, okay? Is my guitar pick on there? Do I know myself now or what? All right. Okay, let's see if this works. How's that sound? Thumbs ups. All right. Oh, I want to encourage hooting and hollering and clapping or whatever you need to do, because this is a joyful time, all right? We are far too young to be feeling this bad, baby. And you're much too young to really believe that you'll always be alone. Hey, I know it's hard to move sometimes, let alone keep walking on this long and lonely road. But you gotta stop, put down the bureau, let yourself sleep, just let your head clear. Tell yourself it's gonna be okay if you can make it through to another day. I stop and put down the bureau, let yourself sleep, let your head clear. Tell yourself it's gonna be okay if you can make it through to another day. You think that no one cares, but we're all so worried for you. And you're wrestling with demons, but it's stuff that we've all been through. And there's a light at the end, whether you believe it or not. You better hang on to your faith, girl. Sometimes that's all we've got. And you gotta stop, put down the bureau, let yourself sleep, let your head clear. Tell yourself it's gonna be okay if we can make it through to another day. I stop and put down the bureau, let yourself sleep, let your head clear. Tell yourself it's gonna be okay if we can make it through to another day. And the weight
weight of it all won't get off your chest, and the bad dreams stay in your head. Don't feel at home no matter where you go, not safe even in your own bed. When you feel too scared to walk down the street, when you feel afraid of the people you meet, sometimes you gotta fight your way out of your own head. Oh, fight yourself, try something new instead, and stop, put down the fear. Oh, let yourself sleep, let your head clear. Tell yourself it's gonna be okay if you can make it through another day. I stop and put down the fear. Just let yourself sleep, let your head clear. Tell yourself it's gonna be okay, yeah, we can make it through to another day.
Thank you.